Okay, go ahead now, Sue.
Okay, thanks. Good morning, everyone, and welcome to this meeting of the Oregon Early Learning Council on December 6, 2023. And I will ask our Council Administrator, Gabby Hernandez, to please call the roll.
Great, and also just also want to start things off and say that some of our agency directors will be arriving at about 10 a.m. So Dave Baden, Interim Director of the Oregon Health Authority, Andrea Bell, the Executive Director of Oregon Housing and Community Services, Alyssa Chatterjee, Early Learning Systems Director, is here. Dr. Charlene Williams, the Director of the Department of Education, Claire Sagoon, the Self-Sufficiency Programs Director at the Oregon Department of Human Services, will be attending for Fariborz Paksaresh, the Director of the Oregon Department of Human Services, and Ben Cannon, the Director of the Higher Education Coordinating Commission, is excused today. Okay, and with that, I'll get started with the roll. Angie Blackwell.
I'm present.
Great. Katie Brooks will be joining at about 10. Peter Buckley.
Here.
Elizabeth Farrar Campbell.
Here.
Barry Ford.
Here.
Robin Hill Dunbar.
Here.
Dr. Peg Miller. Subin O.
Here.
Ruby Ramirez.
Here.
Marie Simons.
Here.
Great, and Sue. So we have a quorum.
Here. All right, thanks, Gabby. So welcome, everyone. It's an exciting time for the Early Learning Council that we are kicking off our new year in December. And we're excited to have a chance to welcome 5 new members. So we are now at a full complement, which is the first time in a couple of years, actually. So we can thank Governor Kotek for her great appointments to this council. So welcome, everyone. We thought we'd spend the first hour of this meeting just getting to know each other on screen, which seems to be our new world. And I thought we would just go alphabetically. And if you would just give us, we have bios in our agenda, as you know, but just give us a little sense of why on earth did you apply to be on the council? And what are you hoping to gain and to contribute to the council based on your early childhood experience and expertise? And so we will start with Angie. We'll just go alphabetically through this list.
Excuse me. Thank you, Sue. I'm Angie Blackwell. I'm the Early Childhood Program Manager for the Confederated Tribes of Grand Ronde. I grew up in Grand Ronde. I'm a Grand Ronde tribal member and have been in this role for 8 years. I actually started the first Head Start classroom here in Grand Ronde 30 plus years ago, I guess it was. I left the field for quite a while and found myself back here running the program. We have Head Start, an early Head Start, center-based program and home-based program, but we also have Preschool Promise, OPK, CCDF, and childcare. So a variety of funding streams that support the program. We serve tribal children as well as community children that live here in Grand Ronde, since we're the only resource available. And I guess that's about all I have to say about that. I've been on the council now for 4 years, I think, something like that. And I feel like I'm just starting to get my footing being a member of the council. What I hope to gain from this experience or contribute to this experience. I think that I get as much as I give by being on the council. I use this role as an opportunity to try to bring other tribal programs into the fold and help connect them to resources. I serve on OTELA, which is the Oregon Tribal Early Learning Alliance, and is AKA the Tribal Hub And my goal really is to help other tribes in the state access the resources that are available, and also have, access to professional development tools, training. It's not just about funds, but it's also about networking within the early childhood field. So thank you very much. I'll pass it on.
Thanks, Angie, very much. Katie Brooks is not here, so we'll go to Peter Buckley.
Good morning, Peter Buckley. I'm joining you here from Ashland, where my wife was the former education director of the Oregon Shakespeare Festival for 31 years. We've raised our 3 kids here. I work with a regional collaboration called Southern Oregon Success, which is a collaboration of all levels of education, healthcare, human services, public safety, and workforce development in Jackson, Josephine counties. And it's a collaboration really focused on children and families. What can we do to help every child succeed? I joined Southern Success after serving in the legislature for 12 years, 8 years of which I was the House co-chair of the Ways and Means Committee. I was given that assignment when the budget collapsed in 2009. I did not have a single day of Ways and Means experience at that point. I was the education chair in the House Education Committee. And the then speaker, Dave Hunt, called me and said, "I want you to take over the budget." And I said, "No, that's crazy." And I turned him down 3 times. But on the 3rd time, he said, he kind of used guilt on me and said, "Are you here to serve or not? What are you here to do?" So I agreed to take on the budget process and was part of that for 8 years. And I think the reasons I'm passionate about early childhood is so much of the work in the budget is kind of restorative work or reactive work. It just bothered me more than I can possibly say that I was signing budgets for Department of Corrections that were higher than the budget for higher education, let alone the budget for early childhood. So when I was completing the legislative work, one of my main priorities is trying to get resources into early childhood as much as I possibly could as we were building our way out of the recession. And when joining Southern Success, I was given an opportunity to immediately delve into partnership with our Early Learning Hub, but also the presentation of the NEAR curriculum. There's a group called ACE Interface that works all over the country with groups that use the science behind neurobiology, how our brain and nervous system develops, epigenetics, how we pass down traits one generation, next generation through the expression of our DNA, the ACEs study, the Adverse Childhood Experiences study, and the science of resilience. So that's what they call the NEAR curriculum. And so I was given the opportunity to spend some time in Pendleton, Oregon with Dr. Rob Anda, who was one of the chief investigators of the ACEs study, and Laura Porter, who from the state of Washington, who ran their program there for many years, using the science basically to help community development in a way that's centered around children and families. So that's just increased my passion for the work. The more I've been in this work, focusing on early childhood, the more insane our society looks to me, because the data is so clear that if we put our resources into prenatal through the first few years, but even up to age 5, we put our resources there and really make sure children are entering kindergarten ready to thrive, we can make a huge, huge difference. So I'm trying to do everything I can to make that happen. So with that, I'll pass that on.
Awesome. Thank you, Peter. What an incredible background. Alyssa is next alphabetically. Welcome.
Thanks. Good morning. I didn't think I'd be in the list, so happy to
You
share.
are a member.
Alyssa Chatterjee. I'm the director of the Department of Early Learning and Care. I've been in this role since May of 2021, which is kind of hard to believe. But I actually started with the Early Learning Division, and we were called the Early Learning Council and part of the governor's office back in 2012. And we moved to become the Early Learning Division in the Department of Education in 2013. And I actually got to staff the council for many years and work with Sue in that capacity. I left to work for Governor Brown in 2019 to be her early childhood policy advisor, and then came back to fill some very big shoes when Miriam left to go work for the Biden-Harris administration. So I have a really unique perspective in that like my career has really been with Oregon and with some version of early learning in the state. And so I've gotten to learn by being a part of conversations with the Early Learning Council from early in my career, from being in conversations with every early learning system director that we've had in the state, as we kind of made the case, as Peter kind of alluded to, for investing in early learning, being in the conversations when the perspective still was just get them to kindergarten and we'll take care of it from there. So it's been incredible to see that perspective evolve. We're not there yet, but seeing the movement over the last 10, 11 years in this field has been incredible. And it's such an honor to be a part of this work as we enter this next phase now that we are a standalone department as of July 1st. In terms of what I hope I can learn and bring, just value. So excited to have a full council again. I got to work with Sue when we updated the legislation around the Early Learning Council's role and function as a result of the first development of Raise Up Oregon, and got to be a part of that work. And so having full membership here, seeing how much the council's evolved and bringing so many incredibly important perspectives from the different sectors that are involved in our system, and seeing this work really move forward and make significant progress since the creation of the first Raise Up Oregon has been incredible. So just really looking forward to continuing to partnering and learning and lifting up those perspectives. And I hope I can bring the insight and information you all need to kind of understand the weediness of us as an agency as we continue to promote early learning and childcare for the state. So looking forward to it.
Awesome. Thank you, Alyssa. Liz Farrar Campbell.
Hi, good morning, everyone. My name is Liz Farrar Campbell. I serve as the county judge over here in Gillum County, east of the Cascades. And let's see, sounds like I'm relatively a newcomer to early education. So when I took over as county judge, we have several childcare providers in our county that rely on the county actually to backfill their budgets. And so that was originally my introduction to early education in our county. Was we have 2 centers here that need our help on a regular basis to be able to keep the doors open. And then in 2020, I had my daughter Ainsley, and was on like many families, was on a wait list for about a year, even here in Little Condon, Oregon. And so obviously had a lot more of my attention focused on the lack of access to care in our communities. And so my county court, I serve with 2 other county commissioners, decided to invest some of our ARPA dollars into creating a team we call Rocket, which is basically a regional team of partners that is focused on addressing the access issues in Gillum County. And so I've been chairing that for about 18 months, and we've done some really cool stuff. We've created some grant programs to help home-based childcares get up and running. We are working with our existing centers to do expansions because they're all at capacity. And we've developed a cool workforce pathway using a bunch of partners' existing programs and figuring out how to align those so that we're able to identify middle schoolers who may be interested in early education as a career path, and sort of figuring out how to align county programs with our partners and our school districts. The nice thing about living in a county of 1,800 people is that we can be really, really hands-on and know individual students that are working through that may be interested in early education, and we can put resources in front of them to help them reach their goals. And then the other big thing that my county commissioners just signed off on is funding a permanent endowment for our early education providers to the tune of about $1 million a year for the next 15 years. So, anyways, very exciting stuff going on. But one of the things that, as I've been talking to providers, I've just realized there's some other barriers that are beyond what we can address at the local level. And so that's really, I think, why I'm here, is to learn more about the system as a whole and help identify things that we see, particularly from a very, very, very rural perspective, and kind of bring that perspective to the council. So that's why I'm here.
Awesome. Thank you, Liz. Barry Ford, welcome.
Thank you. I will admit to feeling a little bit like an interloper. I am new to Oregon. My wife's a native and moved back to lead the Oregon Community Foundation, and so I come to this work with a national policy interest in early childhood. I lead an organization called Council for a Strong America. I've been a part of that organization almost 9 years and have been involved in advocacy to support early childhood programs at the federal and state level since that time, since 2015. I've been president of this organization for nearly the last 5 years, and have subsequently been asked to co-chair a national collaborative, the National Collaborative for Infants and Toddlers, which was initially funded and started by the Pritzker Children's Initiative, but is now supported by Voices for Healthy Kids out of the American Heart Association. I also have served on the task force that recently issued a major climate report, the Early Years Climate Task Force, back in October, and have served as the on the board of the advisory council, the leadership council at Stanford's Early Childhood Center. The reason I give you all this is that my approach to this work has always been about systems change and mobilizing the voices of unexpected and influential messengers to elevate the importance of public investments in early childhood, and to even among folks who pay lip service to supporting public resources flowing to early childhood, having them elevated in priority. There is not a policymaker in the country, this part I can say with absolute confidence, there's not a policymaker in the country that will say they hate kids. And it's not a policymaker in the country that will say they're not good, they're not about supporting the interests of early childhood or supporting kids and families. They're there, right? Yeah. But there are very few policymakers in the country who will elevate it to a level of importance and priority it needs to be. As Peter said, when you look at what other OECD, meaning, developed, advanced, mature economies across the world are investing in early childhood, you look at what we invest in early childhood, the mind boggles. And so, so part of what I hope to get out of this, I think I'm going to get a lot more than I'm going to be giving, but part of what I hope I get out of this, this appointment is a deeper understanding of the issues, the challenges, the levers of influence and power of a state I've adopted. And two, I hope to be able to give experiences, strategies, insights as to how we can borrow, steal, adapt lessons from other places to help improve what we're trying to do here in Oregon. So.
Wow. Welcome, Barry. We're really glad to welcome you as an interloper. That's an interesting definition. Robin Hill Dunbar.
Good morning. Thank you. Wow, it's amazing to hear about a little bit from each of you. I'm humbled and excited to get to know each of your perspectives. I have so much to learn and bring. So I'm at the Ford Family Foundation. I'm a senior program officer, but I have spent the last 25 years of my career in early learning in Oregon and all kinds of different roles that my bio might share a little bit about. And I also, before I started my career in early childhood in Oregon, I was also a young mom accessing all kinds of the services that we're trying to improve still, and have that perspective that I think I bring with me all the time. I think that the Ford Family Foundation, where I've been the last almost 8 years, is an incredible organization. Many of you would know much about it from Ann Kubish, who served on the council before me. Those are big shoes to fill. And we prioritize, champion, and try to be the voice and support all of rural Oregon and Siskiyou County, California. I love how many rural champions that we have on the council. So I know that we can, I loved hearing your voice, Liz, too, and learn from each other. But the thing that the Ford Family Foundation really values is the strength of our rural communities, and also knowing that as we look to bring equality in every way into the state, we can't forget about all of those who have been disadvantaged by all kinds of things, including rural disadvantages. And so I just appreciate being able to bring my background, experience, and hope to lift up the voices of the rural communities that share with us the things that are most important to them as it relates especially to early childhood. We also have, we're headquartered in Roseburg, so I'm here in Roseburg. I also grew up down in Southern Oregon, and so it was coming home for me when I joined the foundation. And we have staff that are field coordinators located around the state. And so we have representation in many parts of the state, including in Condon. So it's great, Liz, to have you here too. And I hope to bring some of their experiences and what they're hearing from community into this role as well. And just to learn from all of you. And systems work and improving the systems is a passion of mine as well. After being in different roles, working direct services throughout the different roles of direct service to management and above, the systems work is what can really unlock some of the barriers that we all are struggling on and to fix and to work on. And I just hope that I can bring some of the thinking that I have learned and help to make things better for our kids in rural and all of Oregon. All of our children are important and valuable. And I'm excited to be here. Thank you.
Awesome. Thank you, Robin. Peg Miller.
Peg Miller, I'm a pediatrician in McMinnville, and have worked in, I mean, several of these, the comments that people have made are echoing some of my background as well. I have practiced pediatrics for almost 40 years, mostly in rural parts of Oregon, and have a particular interest when I was in primary care, which I did for about 30 years. With special needs kids, kids that had special healthcare needs. And for about the last 25 years have been involved with our local child abuse assessment center, doing medical assessments on kids that have experienced abuse or there were concerns regarding neglect. All of that, plus the rich interaction with patients, has really brought forward how rich families are in kids' lives, and that we can't sort of approach helping kids be ready for school if we can't build up families. And that has become particularly important. Part of my work with child abuse was getting to kind of on the early end of the ACEs study, and now really looking at positive childhood experiences and how those are so important, and the early neurobiology of kids and how important those early bonding and attachment times are to their social and emotional development. And I really think if we can continue to invest in families and build up families, we're going to have stronger kids and kids that are more ready to learn. As far as my contribution to the council, I have learned far more than I have contributed. I think I have a strong feeling for the interface between child health and their ability to learn, and that's both their physical and their psychological health. And so I think I can offer some perspective about that, as well as childhood development and just kind of one-on-one working with families, and realizing that all families want the very best for their kids, but some families have more skills than others to accomplish that. And so if we can build up those families, it's a good investment.
Awesome. Thank you, Peg. Subin.
Hi, everybody. I am Subin O. I'm one of the 3 co-directors of Teaching Preschool Partners, where we work to transform public education to utilize practices based on the capabilities and assets of our youngest children. And in 2002 is when I started my journey in early childhood and in education. I was doing after school teaching music. I did social skills programs and early intervention. I did lots of different things, everything you could possibly imagine in and around the classroom. And I left a classroom teaching position that I loved because I felt that I wanted to contribute to more of a policy conversation. I wanted to participate in that conversation. I'm very much practitioner focused and thinking about what all of these investments and policies mean for our professionals. And so I love that job. I would have stayed there, but I was mentoring college students, teaching college courses, and I was getting paid $13.75 an hour. And so that's what it's like as an early childhood professional. And so I would say some of the major kind of areas of focus for me here on the council is I have seen from a variety of fields and disciplines, not just in early childhood, where investments are made and it's made for the middle and doesn't help the people on the margins and doesn't benefit the lives of people who are consistently ignored from those investments and from benefiting from those investments. And so I'm very much focused on that. I would also say that our school districts have a very important role to play in a mixed delivery system. And there are some unique challenges in terms of bringing them to the table, what kinds of things school districts can and should be doing in order to deliver on a system for our youngest children and our families. And I would also say that the other kind of contribution that I'm bringing here is something I already mentioned is there's a disconnect often between the policy conversation and the implementation and what actually happens on the ground. So for example, we can take all this wonderful, great, really useful research in trauma-informed practices. And what I've seen is teachers or professionals then utilize that in a very deficit-oriented way or as a way to blame children or things like that. And that's an implementation challenge, right? It's not that the research is wrong. And so these kinds of challenges are the kinds of things that, you know, I appreciate the word weediness, because you'll often find that my comments are pretty weedy in terms of what's going on with our professionals, because that's where my brain is at all times.
All right. Thank you, Subin. You and I talk about the weeds, and we know a lot of good stuff happens in the weeds. So that's not a negative. Ruby Ramirez.
Good morning, everyone. It's great to be here. So I am a program officer for early childhood at the Oregon Community Foundation in based in Portland. But my work is statewide, and the foundation, my work really focuses on a couple of things.
Ruby, can I interrupt you a second? Can you get either closer to your mic or it's foggy?
You also may want to turn it up, turn up the sensitivity of it.
Is that better?
Oh, totally.
Right. Just picking up my laptop and not from my camera. Sorry about that. Ruby Ramirez, Program Officer for Early Childhood at the Oregon Community Foundation, based in Portland, but my work is statewide. At the foundation, my work focuses on a lot of systems change initiatives and really supporting the adults in a child's life. So a lot of workforce initiatives as well as parenting initiatives. And so I really wanted to share my why above anything, and then I'll share a little bit about what my contributions might be. So how I got into early childhood is very backwards. Started in college, which by the way, took me 14 years to get my bachelor's degree. And so I also think about higher ed, and that will be one of my contributions as well. So I was very much focused on educational equity. I still am, from a racial equity lens. And for me, it was really about college and the university experience, because as I delved deeper into my sociology classes, I saw my textbook case in high school and a textbook case in middle school, and I could keep going further and further back. And so I think it was Barry that said, or maybe it was Peter, about the return on investment in early childhood. And so that's where my brain went. And, I like to say prevention instead of intervention, although prevention is an intervention, but that's sort of the lens I bring to this work. So I've been supporting the workforce for about 15 years at this point. My now husband was also worked at a childcare center when we first met. So I have that firsthand experience of knowing how little the workforce is paid, how difficult the job really is. I remember my husband being sick all the time. And that's one of the little bonuses that childcare providers get in their work as well. So like I said, I've been focused on workforce, but I'm also a trained social worker. And so I really see all of the connections within systems, and I really love the Raise Up Oregon plan for that reason. So I bring some expertise in a variety of areas. I've worked briefly as a home visitor. I did mental health consultation at Head Starts. I supported literacy programs. So I've done some direct service work, but I've also done policy work. I was a consultant working on mostly workforce issues in California after grad school. And so I like to say that I am a dot connector with people and with ideas. And so I think that's what I bring to the table. Again, my focus has been workforce, really focused on racial equity around workforce. I think that will be a big contribution from me at this point. I think one thing that I'm not as strong in, and that I look forward to digging into and learning from other folks, is around children with disabilities and how we support those families. I feel like there isn't quite the focus that we need to have on that. And I'm excited to learn more about how we do that for families. Thank you.
Awesome. Thanks, Ruby, very much. Marie Simons, welcome.
Hi, good morning, everyone. Well, like Sue said, my name is Marie Simons. I am the Executive Director at the newly named Vanden Dunes Charitable Foundation. And really, I come with a business lens to this council. So we are a funder on the south coast of Oregon. We are also a connector and a convener and a collaborator. And really got engaged in work around childcare very recently. You all have years and decades of experience, and mine is it's just a few years at this point. Back in 2019, there was some childcare that went away in our small town here, and by really necessity and need of our workforce, worked on establishing a child care center in a town that I'm not sure ever had a child care center. So learned a lot along the way. Was fortunate to be appointed to the 2020 Governor's Task Force around affordable and quality childcare under Governor Brown. And, you know, really throughout the years that I've served here in this role, I serve on a number of local boards and committees. I serve on the South Coast Regional Early Learning Hub Board. I've been a member of our local South Coast ESD Board. I've been a previous member of our local abandoned school district board. I serve on our regional workforce board, and I just say all that because I feel like I bring a variety of perspectives, and of course, a lens of childcare. I'm also a mom of 2, and so had that rural experience, as well as many of my friends and colleagues who, when asked about their childcare experience, typically starts with, "Oh, I was so fortunate to find care." And so that really drives me to be engaged in this work, and that we should not all have to be fortunate in order to find care for our children. Really should be something available, quality, and affordable. So I'm here to work on those issues, and I'll echo what Robin said about being a rural champion. I try and bring that lens to the table. You know, it's challenging to sometimes have that rural voice, but certainly look forward to bringing that to the table. And again, you know, really bringing a business perspective. I know that childcare is often, you know, feels great, and we serve our kids and we want that high quality and all the things. And all of that is dependent on the businesses that then service our children in order to do that. So making sure that we come from that perspective and taking care of what is a business that takes care of our children. So look forward to learning and working with you all.
Awesome. Thank you, Marie. And the reason I don't have any other agency directors in the lineup other than our fearless leader, Alyssa, is because they're joining us at 10. So otherwise, because they are members, although non-voting members of the council, we would certainly be inviting them to share their perspective. And as you know, their bios are in the agenda, thanks to Gabby doing a lot of research. So for my, I guess, my connection to and passion for this work, I've chaired the council now for 7 years. I appreciated Governor Brown inviting me to do that, and then Governor Kotek asking me to continue. And needless to say, and this is true, I'm sure, for all of us continuing members, I have learned a ton from my fellow council members and from the staff. So I'm indebted to all of you for that. I have a passion for kids. I've got 4 of my own and am in love with all of them. And I've got 7 grandchildren, and every one of them is in my heart. So that's sort of the foundation of where I come to the early learning work. And then I love to start organizations and pull people together, and with a focus on early childhood. So I was the founder of the Relief Nursery in Marion and Polk counties, Family Building Blocks, and it's now 20-some years old and thriving and serving a lot of high need kids. And I know many of you are familiar with Relief Nurseries and the important work they do. And then I actually was the founder of the Early Learning Hub that's serving Marion and Polk counties. I used to live in Salem. I'm now in Portland. So I know hubs really well and am very passionate about them, as you who are continuing the council and staff know. So it's exciting for me to see how we can pull people together and then watch the magic happen to support kids and families. I think for me, one of the most exciting parts of the council is the fact that we are cross-sector. We have 6 agencies who are partnering with us. And when we come together, and you'll see this at 10 o'clock this morning, we focus on the prenatal to 5-year-olds. And for most of our agency partners, except for Delk and Alyssa, they're sort of birth to death. But we, the council, have the responsibility and perhaps the luxury of being able to really focus our attention on prenatal to 5. And I've found over the last 7 years that building the relationships with our agency partners, the directors, but also the incredible staff who work with them and support them, has been one of the most rewarding and really fun parts of this work for me. I've mentioned to some of the new members, there's a group of our agency partners at the management level who meet every month and focus on implementing Raise Up Oregon. And they are incredibly important pieces of us trying to build this system. Some of them are on this call, and you'll be hearing from some of them later today. It's the Raise Up Oregon Agency Implementation Action Team, RUIAC. So you'll hear that crazy word that David Mandel thought up. But it's a great group of people, and hopefully you'll have the opportunity to get to know many of them over the next several years. So that's sort of, I guess, where I'm coming from. And now fortunately, we've got about 10 minutes before the agency directors join us, where we can just have a conversation among ourselves. I want to throw one thing out that I'm hoping the council can really focus on this year and pay more attention to, play a bigger role in than we have in the past, and that is advocacy. You know, and whether it's advocacy as a council, as a body, or advocacy for each of the 11 of us around the state and in our own networks. I think we have a lot of expertise in that. We've got a former legislator on the council. We have a national advocate. That's what Barry does. His council advocates with businesses and with the military, right, Barry? I mean, 2 unlikely suspects for early childhood.
And law enforcement. So those 3, law enforcement, military, business.
Okay, not the usual suspects, but incredibly influential and important partners to build. So I really am hoping that we as a council can look at ways to be advocates for our agency partners and the work that they're doing as we all try to implement Raise Up Oregon. So I'll stop there and just open it up for comments, questions, perspectives on what we've heard.
So I had a question listening to Ruby talk about her approach. And Ruby, did you see the article that was an OPB a while back about Kentucky's program where they're, as you're nodding your head, I was really impressed by that they're paying parents to become trained to be part of the early childhood workforce in exchange of then the parents get to have their kids into childcare and have that payment. So I'd love to talk more about that, and if possible, find a way we can get that in front of the legislature in 2025.
Wow, that's let's do it. I love that idea too. I mean, it's sort of the Head Start model, right? Where they train parents, and so making it bigger, making it more expansive. I think that's a really interesting idea. I'd love to chat about it.
Cool. Thanks.
And Sue, I'm also really interested in the advocacy conversation. I don't know if I said this, but I think of myself as kind of a policy nerd. You know, Alyssa sees me at all the meetings, so I would love to brainstorm more around that as well.
Awesome. Thanks, Ruby. And Peter, we may end up wanting to think about a work group of the council for those of us who have time and want to really focus on this and be much more specific about how we're going to be advocates. It's certainly one of the roles on our list of roles. And Marie, I love the list of roles that you just listed off as funder, connector, convener, collaborator. You know, those are all roles the council plays and needs to play, and we will just add advocate to that. So great list. Other comments, observations?
I was just gonna say, I love to hear that this group is interested in taking a look at some other promising approaches and practices nationally, and then learning and seeing how that can be interwoven into things that we look to do in this council. So I'm excited about hearing all your willingness to do that.
Well, and I am guessing that Barry, you may well be able to bring some of those national examples to us.
I can bring some, and what's interesting, what I'm finding interesting is that there's innovation happening in this space in states that you might not think of. For example, I was just in Mississippi, deeply red state, and they have established, they've focused their early childhood infrastructure first around pre-K. And so they've created something called community collaboratives that require the school system and the nonprofit mixed delivery system in that county or community or that region of the state to work together to get state resources. And collaborators only get resources if they meet near standards. So they started with an emphasis on quality. We were critical in getting the initial legislation passed back in 2015 with only $3 million statewide. Now that collaborators are funded at about $33 million. And they're across the state, and they are driving the collaborations you want to see between school systems and nonprofits. Wow. And driving quality. It still doesn't reach enough. And now is that the scope isn't there, but the idea of it, starting with quality, building in the match, requiring collaboration is a very interesting and I think useful idea. And that's Mississippi.
Wow. Very exciting. So, yeah, Marie, there's one initial answer to your question about, what are the other models out there that we could take a look at?
I'm wondering if Liz might be able to talk a little bit more about how did you get your colleagues to agree
$1 million
to set up for $1 million?
Good question.
You know what? I think it started by having, it's a little town that we live in, but I think we have employers on board. And so the funds are actually, we are a host to Waste Management as our largest employer here. And so the county has an agreement separate from early education that is, we receive host fees from Waste Management here. And those are discretionary dollars for the county court to use. And so as part of our Rocket team, Waste Management is at that table. And we were talking about ways to permanently stabilize our childcare centers. And the Waste Management representative said, well, why don't you think about diverting a portion of what we send you every year? And so I raised it with county court. It so happens, because it is a little town, that the Waste Management representative is also married to one of my county commissioners. So I think that helped. So he thought it was a great idea, of course. But I think the other thing is having employers at the table who recognize the importance to their own businesses to have places where their workers have a safe place for their kids to go is really compelling. So really for the county court, they decided that that 20% of the fund that we get from waste management is what's going to go into there. And that was supporting our general fund. So basically the county decided that we would tighten our own belts in order to make this investment. And yeah, so it's exciting, but we're fortunate in our county. Not every county has that discretionary sort of pot of money that's sitting there. But this particular court, thankfully, recognizes the importance of it. And we're like any other community, I think, although we are much more aware of how the lack of childcare, I think, impacts our community. So for instance, we have a little clinic here. They were trying to hire new staff. One of their providers left. The staff that they had identified has a young child. They called their child care center. They said it's a 3-year wait. So they had to turn down the job. So the commissioners are much more aware of those situations and can see the direct line between the lack of access and other community services that are happening. So it's probably an easier sell in my community than maybe larger communities where you're more anonymous when you're working through that. So
it's still very impressive, and I'm going to use it to pound on my county commissioner and say, look.
Gillum can do it.
Gillum do it.
Right.
I probably know your county commissioners, so send them my way.
Well, congratulations. That's great.
Thank you.
Yeah, that's very exciting. And I see Katie Brooks has joined us. Yay, Katie, off of her 9 o'clock meeting. Katie, we're just wrapping up this section, but how about introducing yourself just real quickly for the other council members?
Sure. Hi, everybody. Apologies for being late. I'm Katie Brooks. I'm the CEO of the Bend Chamber of Commerce, and I am entering my second term on the ELC with the fabulous Sue Miller and Peter and Angie and Peg and all the rest of them. And thrilled to be here. I entered the childcare arena in a very strange way. I did so through the business community because of the lack of childcare in Bend, and started an initiative several years ago that included several steps, including hiring a childcare accelerator, working with a cohort to secure ARPA funds for childcare expansion, doing paid apprenticeship programs through our local workforce, and a lot of other strategies that we've employed. With the end result, my obvious interest is additional childcare for our community, and I have learned a lot. I am the person who is at the table who has the most to learn, I think, with the Early Learning Council and all the things that they cover. And it has been a great experience. I welcome everybody who's new here. It's a great group of people, and I'm a believer in the outcome, and I'm really happy to welcome everyone who's new.
Awesome. Thank you, Katie. And Katie also hosted our council retreat in Bend in October and just did a fabulous job of introducing us to the community. So Katie, I want to thank you again for that. It was awesome. Okay, council, we are ready to move on and welcome our agency partner representatives who are with us today. And on behalf of all 11 of us council members, I want to welcome you and also say thank you very, very much for being with us today. We appreciate you a lot. And I'm going to start with the ODHS representatives because I know they've got other commitments they need to jump off for. So Dr. Brown, welcome, and I'll let you introduce your amazing team who are joining us, and we appreciate all of you a lot.
Good morning, everyone, and happy December. Thank you, Ms. Sue, for allowing us to be in this space, and to all the council members and the new ones. It is such a blessing to be here. And I'm not going to take a lot of our time. I'm going to just pass the baton straight over to one of our directors of child welfare, and that is Ms. Claire. I'll pass it over to you. And again, it's good to see everyone.
Thank you.
Hi, everybody. I'm Claire Sequin, and I'm actually the Director of Self-Sufficiency Programs, strong partner with child welfare, that's for sure. And today, our presentation is all about that partnership. I'm here with Mary Gielen and Jennifer Holman, who are going to go through some quick slides with you. But what I wanted to say, just to kick it off, is that we are doing new work together. You know, SSP, self-sufficiency programs, fundamentally are anti-poverty programs, and we are trying to do some early prevention work to try to keep folks out of our child welfare system. So this particular partnership is bringing that all to life in policy and practice throughout the agency. And so I'm really proud of this work. It's cutting edge for us. It's pushing us in a lot of new directions. And it's really exciting because we also know that it's working. So with that, I'll just turn it over to the team who are in the trenches every day to give you some more details about it.
Great. Thank you, Claire. Hi, I'm Jennifer Holman, everyone. I use she, her pronouns, and I'm the Family Preservation Manager for both child welfare and self-sufficiency. And we really appreciate you giving us a little bit of time today. So we're going to go through very quickly, high-level overview of family preservation and Family First, and happy to answer questions if there are any. So if we could go to the next slide, that would be great. So I'm going to talk a little bit about family preservation, then hand it over to Mary Gielen for Family First. So as you'll see on the slide, that ODHS, as Claire indicated, is really focused on equitably serving families and children in their homes and communities instead of separating them for the purposes of foster care, and supporting all folks having access to the supports and resources that they need to achieve their goals, be together, stable, and safe. And so family preservation is one way that we're putting the vision for self-sufficiency and child welfare into action. So it's an approach that we're looking at to practice across child welfare and self-sufficiency. And this effort really involves the collaboration between families, community organizations, tribes, and in particular self-sufficiency and child welfare. So we're hoping to work with families and communities to hear from them about what they need, when they need it, how they need it, and who they need it from. And that is what we're building and delivering. So we're doing this really having it seated in values-based engagement, looking at concrete supports and connections and tailored services for families. And if we could go to the next slide. Great. So we are in March of 2022, we launched 3 demonstration sites throughout the state of Oregon. And in these demonstration sites, child welfare and self-sufficiency staff are beginning to try out and refine new practices that we're hoping will increase family stability, safety, and ultimately well-being. And so due to some of the successes that we've seen in those initial demonstration sites, we have recently expanded to 5 new sites. So you can see cohort 1 is those initial sites. Cohort 2 is what we've expanded to. Those new sites in cohort 2 are right now in the middle of their readiness work. And in the beginning of 2024, we'll officially be kind of installing the new practices that we've understood really support keeping kids and families together and supporting stability. So in those demonstration sites, it's become really clear that there are foundational elements to this work, that if we can get really strong in those foundational elements, then any of the innovations that we put in place are going to be stronger because of it. And those foundational elements are intra-agency relationships. And right now we're focusing on child welfare and self-sufficiency. We are pulling APD into those partnerships in some of the new sites. Community engagement is another element, as well as those practice improvements, and then supports and services. And all of these foundational elements that we're looking at are really centered in equity and data informed. So looking at that for all of those elements. Some of the things we're seeing are we're continuing, APD, I'm throwing around those acronyms again, I apologize for that. We continue to see that 0 to 4 is the most prevalent age group that we're experiencing in these in-home services for family preservation in our demonstration sites. And so we're really working to support our sites in strengthening their partnerships with early learning hubs and early childhood services in their communities. It's also clear that providing economic and concrete supports positively impacts families and helps us get closer to addressing that root cause of involvement with systems, and that being poverty. So really, as Claire mentioned, that anti-poverty work. So that family preservation is kind of focusing on that practice side. I'm going to hand it over to Mary to kind of talk through Family First and looking at those services and supports.
Thank you, Jennifer. For those I don't know, I'm Mary Geelan. I use she, her pronouns. I'm the Family First and Integrated Policy Manager. And like Jennifer, I work both with child welfare and self-sufficiency, thinking about how we can integrate our policies to better serve families and keep kids out of foster care. So if we go to the next slide, we know that changing our practices at ODHS alone is not going to get us where we need to be in terms of keeping kids safe and families together. We're also going to need to expand services and supports that are available in our communities to support families. Now using federal Title IV funds that are newly available under the Family First Prevention Services Act, we're able to invest in more evidence-based prevention services in Oregon, and we're really excited about launching some of those. So it includes Parents as Teachers. I'm sure many of you are familiar with as a home visiting program for parents of young children. We're partnering with the Parents as Teachers National Center to provide training and technical assistance and implementation support to providers in Oregon to be able to do the model to fidelity and draw down federal Title IV dollars to support those services. We're looking at expanding that throughout the state and particularly interested in serving families with young children who are at risk of coming into foster care. Additionally, we're also partnering with tribes in Oregon to get training and support from Johns Hopkins University in the implementation of Family Spirit, which is an evidence-based home visiting program developed by and for Indigenous communities. Many tribes in Oregon just recently completed the initial training in that. We're working towards, again, being able to do it to fidelity. And we're also working with OHA on bringing some of those Title IV funds into support parent-child interactive therapy in Oregon. There's already some robust networks, and we want to try to expand on that and bring more federal funds to support those important programs, preventing foster care. In Oregon, in addition, we recognize that Family First only goes so far in the kinds of services that it supports. And so have made additional state investments in expanding prevention services as well. In our demonstration sites that Jennifer mentioned, we've been meeting with community members and asking them what would need to exist in your community to keep kids out of foster care and families safely together, and have developed some really interesting partnerships. It's included a number of culturally specific programs, particularly in the African American, Native American, and Latinx communities. We've also invested in FAIR, which is a home visiting program for parents with substance use disorder, and in support for relief nurseries in some communities. We're continuing those conversations in our new demonstration sites and thinking about where else can we have better partnerships and investments to help support this. So again, that's a lot of quick information from all of us. So if we go to the next slide, I'll hand it back to Claire in case there's any questions.
Thanks, Mary. You know, what I would just maybe say in summary here is that this partnership between self-sufficiency and child welfare really is new to us. And I will just say that because it's we've all got this really strong drive and commitment to this new work. It's actually permeating throughout the agency in any number of ways. And so it is the policy and the practice work, but additionally, we are looking at all of the braiding and stacking and leveraging of alternate funding sources to really begin to say, out of the resources we have in total, how can we bring them all together differently and better to make the changes we want to see through these two programs. And we're really, really feeling the success of some of that work and the innovation of some of that work. And the teams that are committed to the demonstration sites are just excited. We go out and we hear from them and report outs, and you can just hear the energy and the commitment to this new kind of connection together to solve the problems that need to be solved for our families. It's really pretty inspiring. So really good signs, I would say, coming out of the demonstration sites overall.
Wow. Thank you all so much. I want to just let you know that we have council members who either live and or work in most of your demonstration sites. So just keep that in mind, that we're a resource out around the state that we'd love to have you tap if we can be helpful in that way. And also for the benefit of council members, I want you to know that everybody we just heard from at ODHS is heavily involved in the work of the council in Raise Up Oregon, either through REACT, through our home visiting system committee, through a variety of other programs that we're involved in. So you will get to know and see Mary and Jennifer and Claire and Dr. Brown in many other meetings and venues. So I just want to thank you on behalf of the council for being here today, but most importantly for the great work that you're doing. And Claire has played a critical role in the whole merging of ERDC from ODHS over to DELC. And I know from talking to Alyssa and her staff, Claire, we would never have tried to pull this off without you, because we are pulling it off, but you have been a critical partner and we really want to thank you for that. All right, you're welcome to stay on, but we're going to move on. Oh, Joel is here. Sorry, Joel, did you want to participate?
Hi, Sue. You had sent me a note a few weeks back about giving an update about agency strategic planning. Happy to do that. Oh, camera's not actually on. Or, to defer if you have other agenda items.
Okay, if you don't mind, Joel, and I apologize for not following up on that a couple of weeks later, we should move on to the other agency reps who are on the call and hopefully come back and hear about strategic planning that all of the agencies are doing probably at a future council meeting.
Sounds great, thanks.
I apologize for that, Joel. Okay, thank you. Now I saw that, oh good, Dave is still here. Dave Baden is the interim director of the Oregon Health Authority. Dave, welcome, thanks for being here. Council members who are continuing know that Dave has been a very reliable, consistent member of this council. And for that, Dave, we really thank you greatly.
Yeah, thanks, Sue, for having me again, and greetings, everybody. Dave Baden, Interim Director of the Health Authority. You see him pronouns. Yeah, happy to go through. I don't have any slides. Totally open for questions on all wondrous things related to the Health Authority and programs. So much of what we do has such impact on the work that this council cares very deeply about. A couple of OHA colleagues are with me today. Kate Wilcox, who's been a really consistent member of the ELCs, the Maternal and Child Health Manager, and Molly Haynes, who is our Director of Health and Education, and I think has really focused on schools and sort of the connection between OHA and ODE, but for sure the linkage into what this council does and the work thought it was important for that connection to be there as well. So happy to go through a couple of items. First and foremost, I think probably most of you saw that the governor did make a selection for a permanent health authority director. So Dr. Sejal Hathi will be starting in just over a month. I'm not really excited about this. I mean, I just want to just keep being the interim director forever. I'm just kidding. Yeah, I'm super pleased to help welcome her into the state. I am really excited for what she will be bringing from energy, from national connections. She's has in her career had just an extraordinary set of work that she has done in the White House, doing some global nonprofit work, and currently in New Jersey with a focus on public health. She for sure will have a lot of big ideas and a lot of things to bring, and I think is just excited to learn. She's families from the West Coast, wants to get back to the West Coast, and just really was excited to come join Oregon, to join Governor Kotek and the Oregon Health Authority because of so much innovative work that we all do here. I think I hope you all have experienced in going to national conferences or other areas, when you say that you're from Oregon, the response is, oh, I hear you're doing this, or I'm really excited about this particular program. And I think that's true in so many different areas. So the innovation that is here, it is sort of good to take a step back and remind ourselves sometimes when you're in the midst of trying to implement all these things, it can sort of feel like, oh, are we doing enough? And the answer is, well, yes, but no, there's always more that we can do, and especially trying to help Oregon's most vulnerable populations thrive better is very key. She will have opportunities to come join the ELC, and just look forward to you getting to know and work with her. So just wanted to announce that. I am still staying at the Health Authority, excited to start sort of a role as a deputy director. I'm still working through all the portfolio things and how all of that works, but just will continue to try to help OHA where I can, and keep moving forward on a whole bunch of areas. So the big piece I wanted to talk about today is where things are in our Medicaid 1115 waiver implementation. And again, for those not steeped in the wondrous world of Medicaid, the 1115 waiver is just how we operate Medicaid in this state, and how us and many other states move forward in innovative proposals and ways to really push forward Medicaid into a more efficient and effective health promotion entity. And I sort of use that health promotion on purpose, because one of the key things that we're moving forward on is around moving Medicaid and allowing Medicaid coverage as a benefit into more upstream categories, into social determinants of health, and in the parlance that we're working with the Center for Medicare and Medicaid Services, as health-related social needs. And excited to have new sets of benefits around housing, around nutrition, and around impacts of climate and a changing climate, and how Medicaid can, as a benefit, so for a subset of Medicaid members who are eligible based on particular circumstances as laid out in our program, that will be eligible for certain services as we roll out. That, I will say, is really what makes our work that we're doing in Oregon a little bit unique. A lot of states are looking at Medicaid into housing or into nutrition programs, but few states are doing it as a benefit. And so what that means for us is, since I'm looking at Peter on my next slide, I'll use Peter as my person example. So if Peter is a Medicaid member and he meets one of the eligibility criteria that are in our waiver, let's say, that he's eligible based on, meeting certain key transition things. The transitions are moving out of carceral settings or out of inpatient behavioral health settings, being at risk for homelessness, whatever sort of piece that is there. It means that Peter will qualify as all of these things roll in, as he would qualify if he needs knee surgery, as he would qualify if he needs his teeth cleaned, as if he would qualify for occupational therapy or physical therapy. That is what makes, I think, our work different and unique, is that there'll be an actual designation of whether Peter meets those qualifications. And if he thinks that we're wrong, he can appeal it, just like any other benefit, an appeal that, hey, actually, I need this service. Setting that up for something like housing or nutrition is a brand new thing in this state. And so I will say that while I'm very eager to get all of these benefits started, we really need to do this in a thoughtful way so that, frankly, our systems, our CCOs are ready to do this. Because I don't want Peter to be frustrated because he doesn't get access to a necessary benefit because we don't have our stuff in order at the state or at the CCO level. That's really what the focus is ahead of us. I did want to talk about sort of two things that are right in front of us. And first is the first benefit that is coming up in this new health-related social needs is around implementation of this climate benefit. And what we asked for and got an okay from the federal government, from CMS, is to distribute, and in some cases proactively distribute, whether it be air conditioners, heaters, depending on particular circumstances. In some ways, we asked for around emergencies, and in others, we're looking at those in particular populations to again proactively support and see if certain devices could be helpful. A lot of this came from just more and more climate-based emergency, more wildfires, more heat dome events, and obviously the impact that those emergent events that have on people's health, very much in particular, and only that this is going to be more common and get worse over time. So we're rolling out now in early 2024 this benefit, and the focus is going to be on, as I mentioned, sort of certain sets of transition populations. So those that are involved in the child welfare system, those that are dually enrolled. So this would be that are enrolled in Medicaid and Medicare. So in some cases, some of the most vulnerable senior populations that are out there, and those that are transitioning from residential settings. We did ask for some additional pieces that CMS said, you know what, that's a little too far. And in one case around during emergencies, there was an opportunity to distribute climate devices during emergencies. We asked for some flexibility in that from the federal government and didn't get it. So as with every great program, we had to adjust, and we're starting out in this way to really allow CCOs to do some proactive outreach to eligible members and say, hey, I think you qualify. Here's what we need to do, which will, I think, allow for a more seamless way to roll out this benefit. So that one is front and center over the next few months to be ready for, and excited to get that benefit to roll out. The other piece that is really interesting is, as part of what we asked for, is capacity building funds for community-based organizations and organizations that are going to be part of these benefits, whether in housing or nutrition. And so we are going to send out over $100 million out to CCOs to run local, sort of locally based competitions to really focus on housing and nutrition organizations to get them ready to deliver this benefit. What training capacity, what systems work is there. We're moving toward more closed loop referral systems called community information exchanges. And how do we improve those around the state so that housing and other nutrition providers can be more actively involved. And there will be these regional grant programs that will start in early 2024 to have local capacity building support and other pieces to go there. So look for more information out about that. And again, it's really about getting organizations ready to go to deliver this benefit. And last but not least, and Sue, I'll turn it back to you for questions. I just also, coming to the ELC, I always will go back to one of the benefits that we've talked about that we got in Medicaid is now implemented, and I'm just excited to see what impact this will have for kids in Medicaid and readiness for schools, all sorts of other pieces. And that is, we have one of very few states that will have continuous Medicaid eligibility for any kid up to age 6. So what that in plain language, what that means is that if a kid is born into being Medicaid eligible, and again, there's much higher limits for in family income eligibility for that kid to be eligible, or at any point in their 6 years, they that family has income or other eligibility that gets them onto Medicaid, that kid will be on Medicaid for that entire 6-year process, for that first 6 years of life. I am just really excited to see what programs can be built to wrap around this. I think the interaction with the early learning hubs, with ready to school programs, I just think that there's a lot of growth opportunities between CCOs and other local communities focused on this population, because that kid, assuming that they don't move, which again, if they move, they will change CCOs, but that it allows CCOs to really see that kid as their member up until age 6 and being in school. And I think that there are so many opportunities to both see what impact this has on the health of those kids, readiness for schools and other things. And just, I think, a really interesting spot of OHA, our ODHS colleagues, the Early Learning Council, the Early Learning Division. I think that there's a lot of state connections and just other areas for us to explore in that piece. That is live now. So as we're going through redetermining eligibility for Medicaid for everyone, these kids will sort of be put into that cohort that they will have continuous eligibility up until their 6th birthday.
Wow,
okay, so
Dave,
hopefully that was helpful. Happy to answer any questions.
that's very helpful. You are full of really positive information and positive steps being taken.
I could go to negative information if you'd like.
Oh, that's okay. We're out of time.
I have plenty of that if you'd like.
No, we appreciate you sticking to the positive side of this equation. And I want to congratulate you and all of your staff again on that Medicaid waiver. You know, we've been hearing about it. We supported it, I think, 2 years ago. And It's just a sea change for kids and families in this state. And I know you've got staff working diligently to try to implement that. And we as a council and the hubs as, sort of our local implementers really, really want to support that implementation in any way that we can. So I'll put that out there on behalf of all of us. We need to move on to other agencies. And I'm sorry for that, because I am guessing council members would ply you with questions. But for now, we need to move on. I want to thank Molly and Kate for being with us. And I know we're going to see Kate later in this meeting under home visiting. And Molly, I'm guessing you connect with Dr. Williams a lot. And so you may want to hang out and listen to Dr. Williams, but thank you for being here, all of you. And Dave, thank you again for your contribution to the council and your steadfast connection with us. I'm glad you're staying at OHA. All right, let's move on then and welcome Dr. Williams, who is the, Deputy Superintendent, I may have the wrong title, of Department of Education. And Dr. Williams, we appreciate you being here. Welcome. Good to see you again.
Good to see you as well. Thank you for being here. I was chatting with Alyssa. I'm like, well, am I sharing slides today or not? And so I just would want to see pretty quickly a thumbs up or thumbs down about if you have a good overview, a good sense of what our early literacy grant initiative entails. So give me a thumbs up if you already have like a good idea. I see some sideways, I see some downs. Okay, great. Well, I will share some slides and I'll try to go quickly, and I'll also kind of tag Alyssa in if she could answer any gaps that I might have in some of the explanation. But just really excited about what the department is doing around our early literacy initiative, about House Bill 3198 and the opportunity that we have there. So I just want to make sure everyone can see the slides. Good. Okay, thank you. And so just real quick, that we have this essential responsibility to ensure that every scholar in Oregon can read and write with confidence and competence, and ideally in more than one language. We value the family origin language and what students actually bring to our classrooms and ways we can honor that. In summary, you see that there's 3 components. We have our early literacy success school grants, $90 million worth. We just released December 1st our request for applications, and those are due January 8th. Because this is our Jumpstart Biennium, we are allowing districts, there's a community engagement portion or a board reporting portion for kind of accountability and collaboration in there, where they need to share their literacy plan with their school board. And so that component, we're giving them a little additional time beyond the actual grant application to, number one, incentivize partnership with the department in completing their those applications, as well as giving them enough time and flexibility to be in concert with their school boards. We just recently submitted a letter to LFO around our tribal grants and our community-based organization grants. The tribal grants will include equal distribution amongst our 9 federally recognized tribes. The $8 million will involve a collaboration with community organizations around an early literacy toolkit. So to ensure that we have some common practices and understanding around what early literacy looks like based on the practices identified in our toolkit. And then, of course, we have our DELC Department of Early Learning and Care. So we're really excited about that. And some of you may have heard that what's unique about our early literacy initiative is that we have put in our legislation that, you know, parents and guardians should be considered full partners in their child's early learning development. And, you know, to honor that as we design activities and engagement, because it really takes all of us to ensure literacy happens at a high level. And so here are those 4 components, of course, to increase early literacy, to reduce academic disparities, to increase our support of our parents and guardians, and to use research-based, culturally responsive practices in doing so. And so our team has put together a robust framework. And as I'm traveling around the state, you know, it's easy to hear concerns and complaints in this role about things the department can fix. But one thing that unsolicited, I end up receiving compliments from educators about is the work our team has done around this early learning work. And so here are the guiding principles that I think are just really just represent our values well around what early literacy means. And again, it begins at birth. And I know this council understands that we have to understand one of the tenets that I operate from is, you know, the belief in every child's potential. And so to see this as part of one of our core guiding principles is important. All of our children are full of literary promise. Our families and communities, as I've said a number of times already, play an important role, and multilingualism benefits all of us. And those core skills matter. Teacher knowledge and practice, as we know, matter. And each and every student can be taught to read and write in some capacity. So just, you know, our principles are what guide our work and impact the level of implementation and success that we can have. And so the celebration I have here is of our new early literacy director, and Dr. Angelica Cruz, who's going to help oversee the school portion. As you know, we are excited to continue our partnership with Alyssa Chatterjee, Director Chatterjee, and our continued partnership there. And this just gives you a visual breakdown of how those grants, the blue dotted, just show where ODE operate, and then how we are in partnership with DELC. And as I said earlier, we are in the process of receiving applications from school districts. And so along the early learning front, just a couple additional notes. We are putting forth a request to increase our support for our EI, ECSC programs, because we know that they were underfunded just due to enrollment, our increased enrollment this year. And I think I've already articulated that we've put out the information to our LFO and CFO around our tribal and community grant process. And so we're just really excited about where we are and the story we're going to have to tell around the impact of our early literacy efforts on our students. Any questions?
Have to get off of mute. Thank you, Dr. Williams. Wow, what an exciting time for kids in the state and under your leadership. Yes, let's take a few quick questions. Marie?
Thank you, Dr. Williams, for sharing. I was really excited to hear that, being a former school board member and ESB board member. I'm just wondering, and you don't have to today, but maybe if you could share with us any of the metrics or evaluations that ODE is looking to implement in order so that we can track the success of your early literacy program and see how it's incrementally making impact in literacy in students. I'd say both early, and I'm presuming you're assuming this will have later benefits as well through middle and high school. So just wondering if you could share those success measures with us.
Yeah, that will be forthcoming in presentations. The one thing I can say about that now is our teams, our integrated guidance teams that are working alongside districts to set growth goals and targets, look at the system K-12 and identify at each level, where do we need growth? And, so looking at our early learning, third grade and beyond outcomes. And so, yeah, that continues to be a point of conversation. There are so many different ways to articulate success and to monitor impact and to identify the ones that are going to be highest leverage for our purposes.
Awesome. Subin.
Hi, Dr. Williams. Thank you. I'm very excited for the work that you described and what's coming out. I feel the school districts that Teaching Preschool Partners is in are already kind of discussing and planning and putting together their proposals. And one of the things that just an observation that I'm sharing from you from the number of school districts that we're in is that a lot of teachers, I feel like this is a kind of a hearkening back to the reading wars, right? In terms of it's this or that, it's kind of the either or black and white kind of thinking. And something that we talk about a lot with our school districts who are really trying to another research-based practice, for example, is around bringing play into, young children's classrooms and how that's a vital, important characteristic that, you can see, and there's a lot of value in that. And so I'm just to kind of put a finer point on it, we are helping to show educators that play, strong early literacy practices based on the science of reading. They're not on opposite sides of the stream. They can live together, including what we're saying around multilingualism. And so I guess my comment is, I hope the ODE can also be consistent with that message to make sure that people can feel that and understand that this isn't an either or type of situation.
I would have to agree with you. And I think we've had some conversations about that internally. We kind of live in a choose a side culture in the moment. And it's really, there are practices across the continuum. If we know that they boost achievement and we have a plan and we monitor and implement with, we follow it with monitoring and improvement practices. I think it's really it's about that conversation, because the language we have is research-based best practices, right? And so, like you said, there are many things that can fall in that and promote reading.
Okay, thank you. One more question or comment from Peter.
Thank you, Dr. Williams. I really appreciate your support for early intervention, early childhood special education. I'm glad the governor's office is going to push for that. Are you hearing anything about the regional programs? I work out of the Southern Oregon Education Service District, and there's great concern here about underfunding of the regional programs for children with autism, children with visual impairment, hearing impairment. Have there been discussions about trying to possibly shore up that budget as well?
Yeah, there are discussions, and that's something I could come back to you with. Our Chief of Staff, Tanil Weatherall, has been in some of those discussions as well, while she's straddling 2 jobs, Chief of Staff and still Assistant Superintendent of OSEO. And so, yes, we are made acutely aware of that and been in conversations. And, when we have more information, I'm happy to bring that back as well.
Thank you very much.
Awesome. Thank you, Dr. Williams. Thanks for being with us. Thank you for all that you're doing in your leadership in the education field. You stepped into a very busy, active time in Oregon's education history. So thanks. It's fun working with you, and we'll look forward to seeing you again.
Thank you for your partnership.
Okay. And Alyssa Chatterjee, we would love to hear a DELC update.
Sure. Yeah, I'll piggyback off of Dr. Williams and start with a quick update on our part of the Birth Through 5 literacy plan. So I think one of the things that was really important about House Bill 3198 and the Governor's Early Literacy Success Initiative is the acknowledgement that literacy happens before folks get to K-12. And that is something that wasn't in the original legislation. So I think that was really important evolution of this bill. Similar to ODE, there is a subset of the funds that we actually haven't received yet and have to put forward a proposal for how we'd spend the dollars to be able to receive them. So as Dr. Williams mentioned, there was about 10 million set aside for birth through 5 literacy investments. About 9.4 million of that would be available in grant and aid. The other 600,000 was used for staffing. So there were slightly different approaches the legislature took to staffing for the different kind of buckets of work with this piece of legislation. So we are in the process of submitting that plan to the legislature and hopefully receiving approval for those funds in the short session so we can keep that work moving, but really rooting this work in a developmentally appropriate practice. Subin, getting to your point of play, it's not just about handing a child a book, but really thinking about in the birth through 5 space, that adult-child interaction component in particular, and how we can leverage our Early Childhood Equity Fund and Kindergarten Partnership and Innovation Fund program infrastructures that are already investing in that adult-child interaction work, investing in professional development opportunities between early learning and early grade educators, and expanding access to those services while we do much deeper and more robust engagement alongside ODE throughout 2024 to put forward much more robust recommendations for ongoing resourcing when it comes to early literacy. So that's exciting work that's underway. We also have begun our strategic planning process as DELC. I know for those of you who were members at the time, we talked about this a little bit in October, but the governor has set an expectation that any agency that does not currently have a strategic plan to have that in place by June of 2024. And as a brand new agency, we don't have a strategic plan. So the timing was really great as the council finalized Raise Up Oregon, giving us a really wonderful roadmap to build off of and be able to kind of define in more depth and more detail what DELC's role and responsibilities are. So I think, and Gabby, you might know, I believe there were 280 objective strategies or actions that DELC is responsible for. So we're going through all 280 of those and really figuring out what we can prioritize. What are the operational connections? I think one of the things we're really excited about is that this will not be a strategic plan that's just focused on the policy and program vision like Raise Up Oregon, which is the purview of the council, but especially as a new agency, the fact that we have an operations division, being able to also drill down and define what our operational goals are as an agency and recognizing the effect that operations have on the ability for us to move dollars out the door and get direct service delivery running and meeting those goals and expectations that the council has set through Raise Up Oregon. So we are kicking off that policy and program work in January of 2024. We'll be doing some deep engagement in the early part of the year. We are just in the kind of early stages of honing in around some of our operational goals, and we'll be coming to you as well as the community and the public to kind of give us input on how that's developing, and happy to give you all updates as that continues to evolve as we get closer to June, and recognizing that this is our first strategic plan, and how do we, similar to Raise Up Oregon, find that balance between it being a living document, but setting an ambitious yet achievable course for us as an agency. And then I wanted to give a quick update on the Oregon Tribal Early Learning Alliance, and Angie, love for you to jump in as well. I know this is something that the council has been really interested in, and that, the first objective of Raise Up Oregon really is focused on promoting and supporting sovereignty with the 9 federally recognized tribes within Oregon's borders. And so wanted to share that we've continued to have conversations about what the infrastructure of a tribal early learning hub needs to be in a way that's not going to circumvent the sovereignty of the 9 federally recognized tribes, and what that balance is. There's been a real clear emerging direction around how we can come alongside agencies like housing, ODHS, OHA, who've been working for the last couple of years on tribal set-asides and how to establish a model for that, as well as learning from ODE's Office of Indian Education around things like the Tribal Student Success Plan, and where that balance is of having a dedicated pot of funding potentially for tribes, as well as a percentage of all new investments being allocated to tribes. So what that can kind of look like, that's been sort of the recent conversation. And then how does that infrastructure that would be established with DELC in government to government consultation fit, alongside a tribal hub entity? Anything you'd add, Angie?
I don't think so. I appreciate that, Alyssa. Yeah, this ball has been kind of slowly rolling along, but most recently we really finally had aha, like, okay, this is what we were looking for. And now this is, I think, the path forward. So even though it has taken a really long time to get to this point, I feel like we are in all a better understanding of what we're trying to achieve. And I think that we're going to move quicker now that we've reached that point. Thank you, Alyssa. I think Alyssa summed it up really well.
Thanks, Angie. Sue, anything else that I know we're going to have an update on ERDC and obviously lots of rulemaking, but happy to answer any other questions that are coming up for folks.
Yeah, and let's see if people have questions of Alyssa. I want to just tag on to the Otella conversation, and Alyssa is really the primary representative for us as a council, but also for obviously for DELC in working with the tribal representatives on Otella and figuring out how do we as a council work with and connect with these tribal representatives, as well as obviously Alyssa figuring that out for DELC. So it's been on our agenda. It's certainly something that we talk about. And I just appreciate the fact that it sounds like things are moving forward with the ball rolling a little faster, Angie. And Angie, thank you for serving on that as well, wearing a couple of different hats, including one for the council. Any questions of Alyssa at this point? Okay, and we're going to be hearing about ERDC in a minute, and you mentioned that you're hoping to get funding in the short session for the literacy.
Yep, we have to, the legislature has to accept the plan and they have to actually allocate the Student Success Act early learning account dollars to us in the short session to be able to administer that program.
Okay, and is the plan written? So could you distribute that to us so we'd see what it is?
Yeah, the plan is due at the end of the month, so we'll absolutely share that with you all once it's finished.
Okay, great. And then we may well want to play an advocacy role in that, as well as in the ERDC that we'll be hearing about shortly.
Great.
So thank you, Alyssa. Thanks for everything and being here when you probably aren't feeling 100%.
No problem.
So council, Andrea Bell, who is the executive director of the Housing and Community Services, could not be with us today. And we frequently have other representatives from OHCS join us, with housing being a focus primarily for us with the co-location effort of trying to get early learning, early childhood programs co-located with some of the new housing developments that are going on in the state. So we'll hear more about that in future meetings. And then Ben Cannon and his staff were not able to be here with us. Some of us had a great conversation with them probably 2 or 3 weeks ago, talking about workforce development and the fact that that's one of the council's top 4 priorities for 2024. Ben and his staff are very excited to find ways to work with us and hopefully to leverage some of our support for their work in workforce development. I'm guessing a lot of them are focused and getting prepared for the business summit, which is Monday, and mostly a large part focused on workforce development. But he also knows that, and his staff know that the February 28th council meeting is going to be focused on workforce, and Ben and his staff are going to work with us and Alyssa and her staff in putting that agenda together. And I would invite any of you who would like to be a part of the planning for that session on workforce to let me know, so we can tap into you and use some local examples of what you're doing. And we certainly heard about some when we were in Bend with Katie, but I know many of you are involved in trying to develop workforce in a variety of ways. So we would welcome your input and your suggestions of how to put that council session together. So, okay. Wow, we're 3 minutes ahead of schedule. Time for a breath. So we're going to, I'll just introduce the hub part. So we put a little bit of context around this, especially for the new council members. At our retreat in October, when we established the 4 priorities for the council, we said that one of them obviously is strengthening and working with the early learning hubs, all 16 of them around the state. And so the council members who were present at that time said that they'd like to develop a survey to conduct with the hub directors and just try to get a sense of how are things going, what are they involved in, which partners are they most closely connected to, are there some agency partners, cross-sector partners that they're having a difficult time getting to the table. How are their backbones working and how do their backbones work? Because we know there's a wide variety of backbones for the hubs around the state. So thanks to staff and both our Build Initiative contractors and Alyssa's staff, they put together a survey that several of us council members conducted with almost all of the hubs. One hub director couldn't do it yesterday because she's got COVID. But other than that, Gabby, I think we're pretty well covered with the hubs. So thank you to the council members who made time to conduct these surveys. And what we thought we would do now, just for a little bit of time, is I'm going to ask the council members who did the surveys to just share some of their takeaways. Or, were there aha moments of being surprised or just reinforced what you thought? And know that the information gathered in these surveys, and they all lasted somewhere between an hour and an hour and a half. These were in-depth surveys. The information gathered in those surveys will be used in the coming months as the Council DELC Hub work group moves forward. So we aren't going to, obviously we didn't have time to tabulate everything today, but know that the information will be applied in future meetings and working with the Build consultants as well. So that's just sort of background of what we want to talk about for the next bit of time. So council members who did these surveys, who would like to start with some takeaways and observations? Angie.
I'll give it a go. I met with 2 of the hubs, and I don't know if I should mention which ones they were. Clackamas County was one, and Marion Polk was the other one. And as you mentioned, they were very long, in-depth conversations. And I didn't pull my notes up to refresh my memory, but there are some things that stood out to me right away. The first was they both have very exciting work happening that are unique to their communities. And I was really happy to hear about and really looking forward to learning more about what's happening there, particularly in Clackamas County around workforce development and apprenticeship programs in collaboration with Community College and several other entities. Some of the other things I learned, though, was that housing seems to be the most challenging sector for the hubs to have engaged in their work. The other sectors were pretty much covered across the board that I can recall off the top of my head. But housing was the one that, you know, whether it was representation on their governing body or just in being called upon to contribute to their work, that was the area that I could see needed the most strengthening. And then the other thing that really stood out to me was the challenges that a backbone can present. And that in particular was alarming because it has a lot to do with the resources that are available for delivery of services and how much of that is eaten up by the backbone, above and beyond the 15% admin cap. So that was very interesting to me, and something that I know that that hub in particular would really appreciate some support with. Those are the main things that I remember. Those are my main takeaways. But like Sue said, all of these responses were recorded and submitted to Gabby, so they will be all compiled together for us. But it was a very enlightening experience. I'm really glad to have had the time to learn more about the hubs. Marion Polk, I'm on the board for them, so there weren't a lot of surprises there. But for Clackamas, I did learn a lot about what was happening in their community, and like I said, really exciting work. So I think that's about all for me for now, Sue.
Awesome. Thank you, Angie. Other council members, Peter.
Yeah, I'd be glad to. Marie, I had the chance to talk with Sarah from your hub, and boy, she is outstanding. She's just outstanding. We have a really good hub director here in Jack and Josephine too, but Sarah was really impressive. The most exciting thing from the discussion with Sarah was over the pyramid model training, which I had very little awareness of the pyramid model training that was available, but she took me through it in depth of what's available, including the coaching component, which Subin has talked about how important coaching is, and the fact that there's actually a very comprehensive training program through Oregon State University. It's a module program that includes a way to train people to be coaches. To me, was like a game changer. There's a lot of people, I know everybody on this call, really concerned about what's going to happen in 2026, and are we giving our providers the tools that they need to be able to address behavior issues when suspension expulsion elimination comes in. And for the first time, talking to Sarah and listening to her talk about how this fits together, I started thinking, wow, we have a chance. We actually have a chance, because the pyramid model can be scaled up. It's available to be moved into different providers on a different time scale, but it got me very enthusiastic. Talked with Sarah about how that could happen. Her view, Maria, of working in, I mean, she's on the city council. I mean, she's got great relationships, and I think that's what's fueling her passion and her effectiveness. And she is very complimentary of her backbone. She said it's a workforce investment board, and she said it's a great relationship. So, I finished that call with her just feeling very optimistic about the work that's going on in Coos and Curry. I also did the survey with Renee Brandon from the Early Learning Hub at Jackson Josephine. Also, some remarkable work is happening. Renee hosted a summit recently of community members, leaders to try to focus on the childcare crisis She's developing a menu of ways that people can start to address the different components of the childcare crisis. I definitely going to bring Liz's information about the county funding, because there's nobody from the county on that summit. But I want to get people from the county there too. But she has goals of 1 year and 2 year goals. So like, could we increase? Could we establish 2 new childcare centers in 2 rural communities in our region over the next 2 years? Things like that. That are very doable. And I found out yesterday too that the Care Oregon has contributed $600,000 to an effort to develop more childcare options for healthcare workers, which is a great step forward. So Renee Zwin, I'm on her advisory committee. I work very closely with her. She's on the design team for Southern Success. Her main concern was the speed at which we're moving. There's a lot of complexity what we're trying to get done in terms of workforce, in terms of behavioral health, et cetera. Her concern is that we're not moving fast enough on things like identifying the infant and early childhood mental health entity that's going to help coordinate statewide, and questions about how does that work with, OHA has the parent-child interactive therapy. Are we making a connection there? How is this going to work, and how are these pieces connected? And she really, really, really would love an organizational chart. I think she's brought this up before in meetings, where she'd love to be able to know for DELC, if it's a workforce issue, who at DELC do I contact? If it's a home visiting issue, who at DELC do I contact? If it's a workforce, I'm repeating myself, but the contact info that she can get a direct response from is something that she has some concerns about. She's very happy with her backbone organization, Southern Oregon Education Service District, which we both work for. We had a rough starting out with the ESD, but now it's a very positive relationship, very supportive. And the ESD doesn't charge an overhead admin fee. They charge to administer things like the large grant programs that are going to come through the hub. They'll charge the administration fee for just doing the 5% for handling the grant, but they don't charge rent. They don't charge any sort of overhead fee for being hosting of the hub. So that was very positive in her view. So, thank you. I'm really glad we can engage in this process. And Marie, again, you've got just a great hub director, and it's great to hear about what's going on in Coos and Curry.
Wow, Peter, thanks. Very exciting. These hubs are on the ground making things happen, just what we need them to do. Suben, how about your calls?
I also want to express gratitude for this process. This was a great opportunity. I connected with Abby Lutzkowski, who is the new Early Learning Hub Director for Northwest Early Learning Hub. And I met with Francis Sala and Molly Day at Early Learning Multnomah. And I'll start with some common themes, and then I'll get into kind of some of this distinct issues that I was seeing in both of those hubs. So one, I was also very impressed with the work that they were doing. They're very opportunistic, entrepreneurial folks who look at windows of opportunity and they find it and they grasp it and they go for it. And so I saw that in both of the regions, even though Abby was just getting started. But that mindset of doing that, I think, is a key finding. I think it's something that we need to pay attention to in terms of sometimes it's hard to do all the aspects of the mission of what the Early Learning Hub is supposed to do all at once. And so a lot of times I saw this in both of the hubs. It feels project-based, right? There's this project and then there's that project, and it's those priorities kind of build on each other. Some things take more attention than others. And, so just understanding that process, I think, was really helpful for me to kind of, rather than kind of look at what, which sectors are missing, or kind of starting the conversation that way. That was insightful. I think so I'll get into some of the kind of the differences here. So Abby is brand new to her position, and that also showed me how, while some of the work can kind of follow through, the governance council was really important in terms of making sure there's follow through between a transition in leadership. And I feel like the hub leaders are carrying so much of the relationships and the actual threading of the work that needs to happen. And so that makes me wonder about, how can we distribute that? How can that be more distributed? We know that if you lean too much on one person, there's challenges in terms of sustainability and making sure things follow through. In the Northwest Early Learning Hub, actually in both hubs, I felt like Angie noticed that housing, it was difficult to kind of start those conversations and make that happen. I didn't hear that much around that. Similarly, I heard in the K-12 space, while some people were coming to the Early Learning Hub meetings and participating in some of the conversations, actually creating some traction on what the P3 work should be was difficult. It made sense when there was KPI funding or kindergarten transition activities, but in terms of an actual P3 agenda, I feel like they're hoping to get some more clarity around what that could be. And that brings me to a metaphor that I think the Early Learning Multnomah folks used that I thought was really important. They started off the call saying, we have a population the size of the state of Alaska, right? And so there's a lot of people, a lot of organizations, many of them have much bigger funds than, they're just bigger organizations than the hubs. And those organizations were very clear in saying to Early Learning Multnomah, don't make us orbit around you, right? And so they, instead of using a metaphor of creating a table where everyone sits around the table and, having discussions there, the metaphor they use for how they think of their work is actually a needle and thread. They feel like they are trying to make these strategic moves and connections from one organization to the other or one person to the other. The other thing I was really impressed with at the Early Learning Multnomah Hub is I felt like they were very precise in making sure that racially diverse, culturally, ethnically diverse families could participate in the process, knowing that some people use the word decorum and custom, and to them, it feels like threatening, oppressive, silencing practices. And so Early Learning Multnomah did a lot to make sure that, and they staffed it well to make sure that parents could actually authentically represent their voices and their views in those processes. And the best example of that was how much they were able to shape the Preschool for All programming. So I could keep going, but those were some of the biggest findings. And I also don't know if I understood my homework correctly. When the second to last question, when we were asking people to kind of think about, okay, what are some of the gaps in the work that you're trying to do, knowing that here's the mission, what kind of staff would you need? What kind of funding supports would you need? I told them to dream big. I said, this is a big system that we're trying to put together. Let the council and DELC be the ones that have to, make the hard decisions around, okay, we need to prioritize this or we need to prioritize that. But tell us what is, like, if we were to make this and deliver on it, what would it be? So when you're wading through their responses, that's how they responded to that question. I just wanted to say that.
Okay, thank you, Subin. Yes, this is a diverse state, or states if you think that's Alaska up here. So we've got a big geography here, and Barry can bring in other parts of the country. Peg, could you share some of your findings and what you heard in your interviews?
Gabby, for all the help that she gave me, the technical help and so forth in setting those up. I spoke with Jen Richter from the Yamhill Early Learning Hub, and I'm a member of that. I sit on their board. So I had some inside knowledge of that. I think, and the other person that I spoke with was Christy Collins from Lynn Benton Lincoln Hub, and they were fairly similar in that, again, I'll echo the fact that the sector they had the hardest time kind of engaging with was housing. And I think both groups felt like they had the closest relationships with public education. A couple of things kind of stood out. They were both organizations, both directors were very proud of the work that they were doing, and like were very vocal about the progress that they're making and so forth. And I thought that was encouraging. They have two very different backbones. Yamhill has a sort of unique situation in that they are run through the CCO, the Community Care Organization in Yamhill County. And so they're pretty closely aligned with healthcare and with behavioral health in the county. The Lynn Benton Lincoln is through the community college there, and Christy had glowing things to say about the support that they were offered through them. The other interesting thing that seemed different to me and seemed very successful for that Lynn Benton Lincoln was they have a business liaison as part of as one of their employees. And that's been really successful for them in engaging the business community to work with their hub. And I don't know if other hubs have that model or not, but that was new to me. Yeah.
All right. Thank you, Peg. And yes, I think I certainly want to thank Gabby as well, because she was recording all of the calls that I made also. So let's see, I talked with Central Oregon Hub, which we all know Brenda Comini. She comes to a lot of our meetings. Also with Frontier, and that's Donna Schnittker, who actually used to be on this Early Learning Council. So longtime friend, and she knows us well. And then Four Rivers, which has new leadership, whom I hadn't met before. Shira Skylinski and Angela Bodwell are co-directing the Four Rivers hub. And then Gabby and I were supposed to meet yesterday with Begonia in Washington County, but she has COVID, so we're talking with her tomorrow. But certainly, the difference between, the experienced longtime hub directors, i.e. Donna and Brenda are certainly two of the outstanding ones, and Shira and Angela being new and trying to figure out, how do you be a hub director? What pieces need to be pulled together? And the geography, these are huge. And we know most of the hub regions geographically are very large. And if they're not large geographically, they are population-wise. So I think we want to get, as the work group moves forward, we really want to give some thought to what sort of supports and professional development do we need to offer hub directors, especially when we see turnover. And we know Eastern Oregon is changing this month with Kelly Poe retiring. Brenda is going to retire next year. So we know turnover is inevitable, but I think we want to really focus on what sort of support can we give new directors coming in. I guess I sort of looked at this as what were some of the messages and consistencies that I heard. One is that all of the hub directors said they really would like to have some consistency in what our expectations of them are. And that's not new. We've been hearing that, those of us on the council, for over a year. So we know that's part of what the work group is going to be focused on with Alyssa's leadership and also Build Initiative. And to be really clear and try to be sort of constant in what are our expectations of the hubs, what outcomes are we really going to hold them to. And then the other issue of, are there some activities and responsibilities all 16 hubs need to meet? And are there others that are discretionary? So hubs could have, other agendas beyond what our foundational ones might be. They all have good, positive local examples of collaborative relationships and programs that are going on. And one of the things I came away with was wondering, how are hubs sharing among themselves, but then also how can they share with us what some of these real successes are, what's working well. And I think we all could learn a lot from that sort of cross-fertilization among the 16 hubs. So something else for the work group to look at. Wide variety of backbone organizations, what services they're providing, how much do they charge for the services, how transparent are they with their budgeting, et cetera. We know backbones are another focal area for the work group. And then the last question we asked was, so what's your short definition of what a hub is? Because that's one of the beginning points for our work group is, so what is a hub? And the definitions just briefly were, they're conveners of early childhood programs at the local level. Another one was advocates and system change agents for families. And another was a convener and neutral party to bring people together as problem solvers and motivators. So we've got great hub directors. We've got people committed and very motivated to this work. And I think it's going to be exciting this year to see how we can continue to support them and continue to build relationships with them. The other hub directors were contacted by Ann Kubich, who's obviously no longer on the council, and also Kelly Thorne-Ladd interviewed Kelly in Eastern Oregon, and they obviously aren't here today, but we will get their input. And Gabby, I don't know, because you've done most of these interviews, if you have any thoughts and observations from your experience with this process.
I think I also really do just kind of echo that in the ones that I've sat in, really also kind of just heard that the hubs are really just trying to create a relationship with the housing sector, or really, just trying to improve on it. And I'm actually sitting here really thinking to see if I could really just specify something on a hub, but I think I sat on so many that they're all kind of meshing together, and I don't really want to misspeak on it. But the housing thing, just really something that kind of stuck out with me. And yeah, more to come on that for sure. And really thankful to, just have the opportunity to really learn more about the hubs and the work that they do.
Okay. Well, Gabby, thank you again for pulling all of that information together. You were amazing. Any comments from council members about what you've just heard as far as a really quick overview of those hub surveys? And all of you actually are involved in your own hubs, except for the interloper who's gonna figure out how to connect to the hubs. So any other comments that you all would like to offer?
So this is Marie, and I just wondered what the next step is in the process. It sounds like you guys have had a process here and we've done the interviews and have some reflections, and just wondered what the next step was.
Yeah, great. Thanks, Marie. I'm actually going to ask Alyssa if she would respond to that, because we've got a process in place, which we're quite excited about. So Alyssa.
Yeah, thanks for teeing up that question, Marie. So this was a few things have been happening. It was really clear from the council at their retreat in October in kind of identifying objective 3, and the focus on hubs was going to be a key priority for the next year. And so this sort of initial interview was a way to establish some deeper connections and relationships with members of the council, because there's varying involvement right now. And we're leveraging these survey results, as well as the last 10 years of work groups, reporting, reviews, evaluations, to look at, what was the statutory charge of hubs? What are we asking them to do now, and how close or far are we from that? And to get back to that issue of setting consistent expectations and really being able to define what are those foundational core functions that every hub should be offering, and then what are those additional services or supports that particular hubs may be well suited for. And so we are, as a BUILD state. BUILD is a national nonprofit, and we are one of 12 states that is considered a BUILD state. And this is funded in part by philanthropy. And one of the supports we get is technical assistance, research, and other resourcing from them. And so Carrie is one of our BUILD consultants who was really integral in the development of Raise Up Oregon. And she, as well as one of her colleagues, Karen Ponder, is helping to analyze sort of the last 10 years of documentation. And then we will be working with the hub directors directly to review what's been done, how we've changed course and asked the hubs to change course, and really coalesce around a shared understanding and vision for the role of hubs with the Early Learning Council as well. And then from there, be able to define what are the outcomes that we want to see from hubs. Once we've got those shared core functions, how will we measure those outcomes? And then what needs to change in terms of rulemaking, in terms of grant agreements, to be able to facilitate and track that hub performance, and really be able to lift up and more clearly articulate the role and importance of hubs and the effect that they're having in their communities. Carrie,
So-
anything you'd add?
Yeah, and Alyssa or Carrie, maybe you could talk about the timeline a little bit.
Yeah, we are convening all of the hub directors in January as sort of our kickoff. So we had asked hubs to kind of send us any documents, especially knowing some hub directors have been there longer than some of us here at ELD, to make sure we've got a good picture of what's been done. Our goal is to be able to have sort of this core function work defined by early spring, so that we can then roll into rulemaking changes, grant agreement changes, those outcome and metrics definitions over the remainder of the year, but be able to have enough information as we're doing budget development, strategic planning for DELC, and be able to integrate all of that information and feedback simultaneously. Carrie, anything else you'd add there?
No, you've said everything great. And I think the other thing is, out of all that list, we're also looking for what would be the ideal support to the hubs from DELC, and what would that mean? And so I just want to make sure that you know that that's on Alyssa's and my list as well, so that as you guys do your champion work, as Alyssa's thinking about her proposals for budget, knowing what would be possible to change now and what resources would be needed to add the kind of supports that everybody wants to see for the hubs.
Yes, and this is Carrie McCann. Carrie, do you want to introduce yourself to our new members who don't know you yet?
Yeah, I'm Carrie McCann. I'm co-director of state services from the BUILD initiative. I'm a part of the team that works with our partner states. So as like Alyssa said, we have a network of 12 states that we work intensely with, of really how to do early childhood system building, knowing that even with great departments like DELC, the work of young children and families is across multiple state agencies. Oregon is a lead in bringing together 6 agencies under Raise Up Oregon. So we're very excited to be working with you. We're happy to bring lessons learned from other states. Karen Ponder, who will be doing this work with me on the hubs, was the mother of Smart Start in North Carolina that developed a county-based regional system there, and has worked with many states around the country on the ongoing opportunities and challenges of state systems interacting with regional systems and interacting with local systems. So happy to support the conversation and process in this upcoming year.
Great, thanks, Carrie. Comments and questions, Katie?
Yeah, I wanted to emphasize and just, I guess, reiterate what everybody else has been observing is, because I find some resonance here, because when you talk about chambers of commerce, we are so very different. When you meet one chamber, you meet one chamber. not all of them. And there are some similarities with the hubs. And I'm 100% behind finding the core functionality, because I think that we can all benefit from that. But just realizing the contextual sensitivity of where everybody is, what their networks are, I think is part of the secret sauce of what makes each of these hubs work so well. And I can speak experience having worked with Brenda Kamini. She is goddess-like in making things happen because of the connections that she has specific to her region. So I guess for the new folks too, from one side of this, I see such value in establishing some core functionality without squelching that other piece that is contextually relevant. And also to rely on them for feedback. I would like to do that more, because I hear about things from Brenda and others here that I don't have access to in other ways. And it's feedback on our decisions on rulemaking and on how Baby Promise preschool promise funds and funds are getting out into the community, things of that nature. So I'm greatly appreciative of that aspect of them as well. So that's it.
Awesome. Thank you, Katie. Yeah, your hub is remarkable, just a remarkable leader in the state. Subin, you had your hand up.
Katie literally said everything much better than I would have said it. I think to add to Katie's comments, I'm wondering if, or actually I'll just say, I plan on staying in touch with the hub leaders that, I connected with, because I think they'll be better, they will give better feedback on what the DELC is about to put out, right? And so in order for me to really understand how, as a council member, what kind of feedback I can give, I just need to keep learning and stay in touch with them. So yeah, I think I'm just adding that comment.
Yeah, thanks, Subin. In fact, I think I neglected to say that, but that was another reason the council in October decided to do these interviews, is to start building relationships between us council members and the hub leaders around the state. So a really, really good point. Peter.
Yeah, just to lean on that point just a little bit, many of us serve on boards, and this situation with the Early Learning Council, DELC hubs, and childcare referrals and resources, it's a different type of relationship, in that we do need that communication from all levels to kind of what they call the triumphant was one phrase that's being used. Early Learning Council, we need to understand what the hubs are doing, and we need to understand what DELC is doing. DELC needs to understand what the Early Learning Council is doing and what the hubs are doing. We all need to understand, because we're trying to build an early childhood system here that doesn't really exist yet. We're building it now. So it's not like a traditional kind of board only does this, and administrators only do this, and then hubs are something different. We're trying to build the system. And so I appreciate this opportunity to have develop those communication loops that have to happen.
Yeah, excellent point, Peter. Yes, that's exactly what we're doing. And I think we say at almost every council meeting, the hubs are the implementers of Raise Up Oregon. So they're our boots on the ground, or whatever we want to call them. But the council is just integrally tied to them and dependent upon them in many ways. And we need to be supportive also. Other comments from any council members? Whoops, I
just reiterate a little bit on what Katie said. I think just like we have been talking about with the home visiting system initiative, we really need to respect what the local communities, what they see as the needs. And they, I think sometimes when we give an expectation, we need to let them run with that, like how that's going to best play out in their community and how they can best follow through with that, which might look quite different with different hubs. And we need to really respect that they know their communities, they have their relationships, and I think that will help our relationship with the hubs as well.
Good point, Peg. Okay. You know, I love this idea that we're going to really be more intentional, I think is the word, of getting input from the hubs for our council meetings. That was another thing we talked about at our retreat, was making sure that we have hubs. And when we're talking about, you know, certainly workforce development, CCR&Rs involved in the council meetings. So we'll be working with them as we plan the agendas in the future. And once again, I'll say, you know, if you want to help us plan the agenda, January is going to be focused on the social emotional metric, but mostly on the suspension expulsion prevention program. So we're going to start planning that tomorrow morning in our meeting. So that's January. February, I already said, is workforce. And then March will be the home visiting, and April will be hubs. So we're going to deep dive each month. As you know, that's what we decided also in October. And that's sort of the order that we've set up now, working with our agency partners and then also community-based partners and implementers. So we are open and excited about any input that you might have. Any comments about that?
Yeah, Ruby has her hand up, so just want to make sure that.
Sorry, I didn't see it behind your OCF banner.
Yeah.
Ruby.
Thank you. I really, really appreciate the idea of having hub leaders, R&R leaders sort of help us develop our agendas. I think that's really great to inform it from our folks on the ground. I'm also hearing the comments about you know, making sure that there is local control and local decision making, and there is an avenue to do that. And I wonder if the council has ever talked about the idea of targeted universalism, where, you know, you set some general goals, but how those goals are reached depend on your community and your context and your demographics, your populations that you're trying to serve. So I think there's a way for us to think about that within a framework that allows communities to have some say about it, specifically around implementation. Of course, we want folks participating in the development of policies as well, but in how I'm hearing these conversations about how things play out there, you know, I think we should think about a framework about what that looks like. And I think targeted universalism is a good one.
Okay, thanks, Ruby. Great input, and something that, yes, I think we can work on that and work with staff in exploring that as well, and lean on you as an advisor and supporter as we try to look at that. So thanks.
Yeah, and of course, I'm sure you're guessing, Sue, that I'm happy to help on the workforce agenda as well.
Thank you. Duly noted. As Gabby starts putting together the planning group for February, that will be great. Any other comments, questions, suggestions around the hubs? Okay, thank you all for those of you who had made time to do the interviews and the surveys. Really, really appreciate that a lot. And there will be more to come as we now have new council members to plug into that process. So let's move. I see that we've got Dorothy here, even though we're a little bit ahead of schedule. Welcome, Dorothy. So nice to see you again. Many of us know Dorothy from her former life or former position when she was the hub director for Northwest Hub. And now she is on the DELC staff. So Dorothy, welcome, and we appreciate you being here to give us an ERDC update.
Thank you, Chair Miller. Hi, everyone. Thanks for having me here. So Dorothy Spence, I'm the Child Care Assistance Program Manager. So I oversee the team of individuals that are our Child Care Assistance Policy folks, implementing primarily ERDC, but a few other Child Care Assistance programs as well. And I'm here today to give an update on ERDC. If you go ahead to the next slide. So I know we have some new council members, so I just wanted to really quickly start from a place of reminding us what ERDC is and how it works. ERDC is a program that is meant to help families with the cost of childcare by making payments on their behalf for to their chosen childcare provider. Payments to childcare providers are made up to the state maximum childcare rate based on the child's age, family's eligible hours, provider billed hours, the region of the state, and childcare provider type. And really quickly, just to kind of walk through a parent's journey of accessing ERDC, they begin that journey with an application through the ONE system that's managed by the Oregon Eligibility Partnership at ODHS, or the Department of Human Services. Once that application is put through and a family is approved based on their eligibility, they choose their childcare provider of their choice that has been approved to receive ERDC and report that to the direct pay unit. And then billing forms are sent at the beginning of each month to the child's chosen childcare provider, and the direct pay unit pays that provider on the family's behalf. Just a quick note, the direct pay unit is also now part of DELC as well as of July 1. You can go ahead to the next slide. So just as a reminder, we've seen a ton of policy and program changes over the last 2 years, many of them initiated out of House Bill 3073 that created DELC, along with a lot of other programmatic changes. In 2021, we reduced our copays. Just a note, Oregon used to have one of the highest copays in the country. We now have one of the lowest copays in the country with this, with the copay change. We are paying providers based on enrollment rather than attendance. This year, we saw the expansion of eligibility to students. We also moved to approving part-time and full-time childcare hours for families, allowing more flexibility for medical leave and doctor's appointments. We can authorize sleep hours when there is a 2-caretaker household. And most recently in July, we implemented protected 12-month eligibility. So there are very few reasons a family may come off of the ERDC program with 12-month eligibility. In addition, in July, we also saw the expansion of categorical eligibility for TANF families being able to access ERDC. You can go ahead to the next slide. We also know that changes aren't quite over yet for the ERDC program. Over the next few years, some of the changes that we can anticipate include the childcare provider rate increases. These are driven in part by the childcare market rate study, which informs childcare provider rates, as well as bargaining with our 2 childcare provider unions. So that bargaining was completed as of September, and we will see later today, I'll be coming back to all of you to talk about the rules and updating those provider rate increases that would go into effect January 1 once the council adopts those rules. In spring of 2024, we will also see the eligibility expansion for children regardless of legal and citizenship status. That's also from House Bill 3073 in 2021. And then in 25 and 27, House Bill 2683 that was passed this past legislative session also includes some expansion of eligibility for ERDC. And then we are moving to an alternative rate methodology that would be implemented in 2025 that would look at a different methodology to pay childcare providers based more on the cost of care rather than on kind of the market rate study. You can go ahead to the next slide. So one of the things that we've talked a lot about over the last several months since I came into this position in July is really looking at our total caseload and what's been happening with our caseload. All of the changes that have happened to the ERDC program, what we're seeing is that the program is actually working better for families, and many more families are taking up the program. So you can see kind of a slow increase kind of from July, and then a sudden increase at July of 2021 to July of 2023. You can see an uptick, but then a huge uptick starting July 2023 with that 12-month eligibility. Our total caseload right now, as of November, we just received our November data at the beginning of December. We're sitting at just over 16,000 families on the ERDC caseload. You can go to the next slide. And when we look at our caseload, we look at two things. We look at families that are connected to a provider, so approved for ERDC, connected to a provider, families that are approved for ERDC, but not yet connected to a provider. That big bump that you see, the bottom line, the darker blue line, that's our not connected to a provider yet. You see a big bump in July. Those are many of our TANF families that were coming over into the ERDC program in July and needing that a little additional time to get connected to a provider. So that's what kind of that bump is right there. We also know that since families have that 12-month protected eligibility, once approved, they can connect to a provider and start using their ERDC subsidy at any time in that 12-month period. And so we're really tracking this data closely to understand how 12-month eligibility could impact kind of what we're seeing with families that are approved for ERDC, not yet connected to a provider, what that might mean. You can go to the next slide. And then just wanted to talk a little bit about the ERDC eligibility reasons and what that is showing us. The largest portion of ERDC families are eligible because of employment. The next largest category is what's othered, which includes self-employed families, families that are on an authorized work search or authorized medical leave. And the smallest categories are those eligible for education. So that student expansion that we saw in January of this year, or a combination of education and employment. Go ahead to the next slide. And as I mentioned, we did expand to students in January 2021, and this has contributed to almost 800 families to the total caseload. You'll see kind of both education, but also those that are utilizing ERDC for both education and employment represented here in this chart. Go ahead to the next slide. And then the other kind of big population that we often hear about are those categorically eligible families that are on TANF and enrolled in ERDC. As of December 1st, 2023, there were 3,539 categorically eligible families on ERDC. And of those, about 47% are connected to a provider. Go ahead to the next slide. And kind of what all of this data has been telling us, as I mentioned with that total caseload chart, we know that many more families have taken up ERDC because the program is working better for them. We've expanded to new populations to support more families, but we don't have the program doesn't have the program funding to support the continued ERDC growth. And we did activate a wait list as of November 4th. And that applies to most new families, though there are some families that are exempt from the wait list. And as a note, families will not move off the wait list until the caseload drops significantly or the program is able to get more funding. And families can expect to stay on the wait list for 18 months, but it may be longer. Go ahead to the next slide. So just a note on the families that do bypass the wait list. So while there is a wait list in place, families that are already on ERDC can continue to receive ERDC and skip the wait list. When they reach their certification period or end of their certification period, they have a 2-month window to recertify. If their case closes, life happens, they forget to do their recertification, there's a 2-month window after that where they can reopen and skip the wait list if they continue to be eligible for ERDC. The second population is families receiving TANF. So TANF is one of our categorically eligible families when there isn't a wait list. This is also a population that skips the wait list while the wait list is active. So families on TANF transitioning off of TANF, and those families that are receiving a domestic violence survivor grant, TANF domestic violence survivor grant, in the last 3 months are able to skip the wait list. The third population is families referred by child welfare. So these are specific families that have child care as part of their child safety plan to allow a child to return to home, be placed with a known adult, or keep a child from being removed from the home, there's a specific referral process from child welfare to ERDC. And those families can skip the wait list, provided that they meet the additional ERDC eligibility requirements that are there. And then finally, there's a very small population of families that have Head Start contracted slots, just over 100 families across the state that have Head Start contracted slots, and those slots can continue to be filled, and those families skip the wait list. The last piece that I wanted to share is that we do have resources that we have shared with families and through partners to families. While the waitlist is active, those live on the ERDC main page of the DELC website. That provide a variety of resources and help direct to other programs that may help meet a need if a family winds up on the wait list, as well as referring families to 211. And we're continuing to work with 211, early learning hubs, CCR&Rs, as well as Oregon Ask, the school age after school network, to make sure that we're really coordinated in how we're supporting families during this time as well. And I think that's my last slide.
All right, Dorothy, thank you for the rapid fire and moving us through those slides. You can tell Dorothy has spoken at many venues, including the legislative hearings where you've got 2 minutes to say everything or whatever. So thank you, Dorothy. Let's see, let me ask Alyssa, so just real quickly, and then we'll go to Subin and Robin. What is DELC's ask of the special session regarding ERDC?
We are still developing what that request will be. So we'll have our request submitted in January for consideration, the short session, but we will likely be giving an update to the Education Ways and Means Subcommittee during January legislative days to give an update on where the caseload is, how many families are on the wait list, and kind of build on what Dorothy shared today. And we did get different from the usual 2-minute limit. They gave us 2 hours of their agenda in November to really get deep into the weeds on ERDC and the intricacies and all the changes. So we were really fortunate to be able to set that foundation as we head into the short session with them.
Yes, I listened to that session and it was in depth. Definitely the weeds, but super, super important. And I see that Governor Kotek has, I think, released her request, which is 59 million for ERDC. So I don't know how that'll match up with what you all come up with.
Yeah, and that reflects the data that we'd shared in November legislative days between as sort of the gap, and that reflects a gap considering American Rescue Plan Act funds that we can leverage differently. We need the special purpose appropriation approved by the legislature. There's 8 million they set aside specifically for caseload increases, and then a potential general fund investment.
Okay, so we can expect an update at our January 28th meeting.
Yep.
And then hopefully we will be able to advocate for that in the short session.
Great.
Okay, Subin.
I'm hoping my question is irrelevant and January 28th when we hear back after the short session. But in terms of the wait list, what does it look in terms of prioritizing? You know, if there's a slot open or a spot open or something like that, how does that work? I have Ruby sent this article around targeted universalism, and it's now in my brain. So how would it look like for people to? How would you go through the wait list?
I'm happy to take that question. So I want to preface this by saying that the wait list is managed through the one system, and that that functionality was built when the one system was built and is not able to be easily manipulated in any sort of immediate time frame. So with that preface, the way that it was built, the way that it's also written in rule and statute is there isn't a prioritization to the wait list. So it's first on, first off. So the individuals that would be invited off of the wait list when we're able to do that would have been the individuals that were first able to apply and be put on the wait list.
Okay. Thanks, Dorothy. Liz.
Hi, yeah, I wondered if you could speak more to the upcoming change in methodology. I know from our providers locally that while they appreciate the ERDC slots they have in, they are not even coming close to covering the cost to provide the care. That's part of the reason my county, my day job is backfilling those budgets, is because they're short. And so I was wondering, sort of, first, the timing, and also given that you have a wait list with the current methodology, which presumably what you would see is increases in all of these rural areas that are, I think, currently now not receiving enough really to cover their costs. How do you see those two kind of moving together? Because it appears there's going to be a request to eliminate the wait list, but by increasing the method or changing the methodology, it seems like you're going to be back in a hole. And so in terms of advocacy, like, that seems to be something we should also be talking to lawmakers about, the importance of making those amounts equitable, and that they should expect some additional requests to make that happen for rural Oregon.
Dorothy, I'll offer one clarification first too. The request, the $59 million figure that the governor has shared, that is just to backfill our budget hole. It doesn't eliminate a wait list. So I just wanted to make sure that was clear. It just means that as of October 31, that is how much we would need to not overspend our budget, given the number of families who are actively receiving ERDC resources to their childcare provider. So eliminating the wait list would be a larger figure than that. And David, I didn't know if you wanted to speak to the alternative rate methodology component.
Yeah, I'm happy to jump in as well, but also Dorothy, you should also jump in. So the alternative rate methodology was, all of this is under the federal child care development framework, and it previously was the case that you had to use market rate study, and they do now allow what they call alternative rate methodology, but is really sort of based on cost modeling. I think the important thing to remember is by statute, rates are also a mandatory subject of collective bargaining. So in some sense, what we are really doing is establishing the framework, and the actual determination of rates really happens through that collective bargaining agreement process. But that being said, HB 30373, in addition to alternative rate methodology, also as part of that also said that you also need to look at various elements of the cost of care, incentivizing non-standard hour care and things like that. And so part of the timeline, sorry, I feel like I'm giving too long-winded an answer to this question, is the new methodology also will require us collecting different data from a provider, right? So if there's an incentive for non-standard hour care, then we need to have from the provider what's the hours in which the care is being provided. So all of that means that we really have to have the new provider management platform in place before we're able to make that transition. So we are really still looking a good year out, both to be able to have that set up and then also to move into that next round of collective bargaining. And this all also has to be approved by the federal government before we can make any changes to our rate setting methodology. So we are still a ways out from being able to sort of fully implement. But I think you're just want to echo what I think your main point is, right? It's one thing to change the rate methodology, but if there's no funds behind that, you can't effectively change what the dollar amounts are of the rates. And I think that's sort of what the ultimate concern is. And apologies for that somewhat rambling answer.
Thanks, David. Let me go to questions now. Robin?
Thank you. I love to see all of the things that are to come and all the changes that have happened. So I just thanks for all of the effort to make it better for families and for more families. And as someone who was a student with children, I remember this would have been really helpful. So I So it sounds to me like the 2025, the alternate rate methodology is when we would have a chance to bring the rural rate closer to the urban, if not the same as the urban, right? Because it's already a low rate for urban centers and childcare as well. But I wondered about like the prioritizing of it. David, that was really helpful to hear you describe all that goes into it and what we have to consider. And at the same time, there's like this urgency that we hear from the community. And as our childcare deserts are becoming more and more deserts, it's like the economic stability of especially in rural childcare. It's just like it can't wait. And I just wondered, I don't know what we can do if there's like an extra subgroup that meets, but is there anything else that can be done to prioritize the rates for rural? I know that I appreciate others bringing this up besides myself, but I think I'm saying yes to what Liz was saying and yes to, I understand what David is also describing, but just wondered if you could speak to prioritizing that.
I think David had to step away, Robin, but this can definitely be an ongoing conversation. I think, thanks, David, you can jump into. Rates are subject to bargaining, and so that's a really important part of this process. And then David mentioned, all the different inputs, the federal approval, the one system changes that are going to happen. We're also in the process of developing our own provider payment system. But I also want to name, it will have a limited effect if the ERDC program isn't invested in. We have a $60 million budget hole that will likely continue to grow. And we have a delta of about 5,000 families who've been approved to enroll in ERDC, but aren't being served yet. And while that delta is closing, now that the waitlist is in place, the level of investment that's going to be needed, especially when we look at the 25-27 biennium and the ARPA cliff, because we were able to make money magic happen to make it through this biennium, is significant. And so I also just want to be really clear that if we can find the policy path forward, we need a significant amount of resources to be able to get out of the current budget situation without making additional changes to rates. And David, please jump in.
And also, I apologize if this was already mentioned earlier. We are on a 2-year collective bargaining agreement cycle. And so we did conduct bargaining over the course of the summer. So there is a rate increase that is actually going into effect January 1 for all provider types. And Dorothy, I don't know if there's anything you wanted to add on that. So, I think I think the goal has been to maintain rates as much as possible. So I think the January rates get us to about 80% of the market price survey. So that basically means if you lined up 10 providers in your community with the ERDC rate, you should be able to buy a slot in 8 of those 10 providers in your community. The federal standards for what they encourage states to get to is 75%. So we are actually, with this rate increase, above what the federal benchmark is for states. So,
okay, thank you. Barry.
Yeah, so what I appreciate the complexity and the work that you all are putting in to try and bring about these reforms. I guess I have a couple of questions that relate to the timing. I think you may have answered the first one. Is the reason you can't move faster on moving away from market rate to actual costs because of the legislative and bargaining hurdles you need to go through? So I think that's what I got from you. You can't get to the cost model until you have to deal with all these other.
And I think the other just piece is that we need to have a new data system in place, and that's the other piece that's in process.
Gotcha. So then the second question is to get to what Alyssa was saying. What do we need to do? What are the, I imagine there are several, right? What do we need to do to get more money flowing into the system? I mean, are we advocating for a tax increase? Is that possible? Are we, I mean, again, new kid. So just tell me what the policy and political barriers are around raising the money here.
Don't everybody speak at once.
I could
That's the many $100 million question.
Mary, I can
Peter.
take a stab at that. We can go back 30 years. The various measures that passed, Measure 5 is a property tax cap that passed in 1990 that shifted the responsibility for K-12 to the state away from local school boards, et cetera, in terms of financing and local property tax in terms of financing. That changed the budget dynamic in Oregon significantly. A huge change happened then in 2019 with the development of the Student Success Act, and a corporate activities tax was added to revenue for Oregon, which brought in some significant dollars, and some of it does go to early childhood, but there's not nearly enough money right now in the state budget going to early childhood. The possibility of another tax increase, I mean, I think it took about 29 years to get the corporate activity tax, because we've been looking for 29 years to find a way to increase revenue for the state. We did a little bit of a fix in the worst of the Great Recession. We increased income taxes for the top earners by a slight bit. So the answer, it's a long answer to your question, is that it would take a political movement, a significant political movement, to increase the budget and to allow funds to get into early childhood at a level that would make a significant difference without severely damaging K-12.
Right, and we've read a lot about that lately too.
And Subin's ready to build the movement. So am I, Subin. I'm ready. Let's go.
I know. Marie.
I'll be brief because I'm really just underscoring what we've heard from Robin and what we've heard from Liz and Barry, that the issue of equity with respect to these rates is a significant rural issue. And we're talking about these businesses that are doing all the great work we want them to do underneath their roof. And there's not enough funding to be on the table for them to continue this work. So I hear that there are challenges. I know my hand is raised in willingness to sit at a table and be helpful, advocacy, whatever we need to do. But this is a top priority from the rural perspective. I hear this every time I talk about childcare in a group. In the ERDC rates for rural, based on your zip code, they're not enough to cover what it costs to care for the kids in the way that you want them to, and a way that they can in a sustainable way. Thank you.
Okay. Thanks, Marie. Okay, obviously more to come, and super important issues. So we will stay connected to Alyssa and Dorothy and David on this in the months ahead. So Council, we have another tight afternoon, as you can imagine. We need to reconvene, so you're going to have a very short lunch break, I'm afraid. Feel free to eat lunch on the call, but we need to reconvene at 12:20 for our home visiting system report that Peter and Peg are going to lead. So sorry for the short break, but why don't you grab a bite to eat and eat while we listen to Peter and Peg talk. So thank you all very much. We'll see you at 12:20.
So Sue, you're saying 11-minute break?
Yes. Sorry, Angie.
Okay, I'm going to pull up the slide just for the break, and I'll still be around to admit participants.
Okay, thanks, Gabby.
Yeah, you're welcome. Sue, also just want to let you know that your camera's still on. Hey, everyone. Okay, so pulling up the slides, I'm still waiting for folks to just jump back. And quick reminder that we are still live streaming. And if you're eating off camera, if you want to just mention in the chat that you're back and just eating off camera, totally fine. Just want to make sure that we have everyone present. Mhm. Okay, perfect. So I have your slides up, but I'm just counting to make sure I'm taking. Okay. I'm just gonna give it one more minute to see if Sue jumps on. Otherwise, I think I see Kate here. Beth, Kate, are we waiting for anybody else? Otherwise, I think we might be able to get started.
Hi, sorry, just had another call. So we're back. Sorry to be a little bit late, but thank you all for taking a very short break. I won't even call it a lunch break. Oregon Home Visiting System Initiative. I think I've talked to all the new council members to tell you this is our initiative that we launched by appointing an early home visiting system committee almost 2 years ago. And it's been fast-paced, but we're very excited about where we are and where we're heading, thanks to Peter and Peg and their leadership in co-chairing the committee. And now thanks to Beth Green and PSU for being our primary coordination center. So with that, I will turn it over to Peter and Peg.
Thanks, Sue. I think we're just going to give you an update here on where we are, and I appreciate the council giving us the time to do so. We can go to the next slide. And Peg, I think this one's yours, I think.
Sure. This is just sort of a reminder of the purpose of the committee. We were formed about 1.5 years ago now, and I think we're working towards accomplishing these 3 objectives. Next slide, and I think that one's yours, Peter.
I think I get to do the path to today. So in April 2022, we were able to hire a consultant, Christy Cox, to engage in support work to gather data about the barriers and opportunities for developing Oregon's home visiting system, the HVS. And in June of 2022, a working team was formed to provide the intensive work needed to research and refine a set of recommendations to guide the development of the Oregon Health home visiting system. This group included representations from the existing home visiting collaborative. The collaborative is made up of people who are agency people that were working on the home visiting area. December 2022, there were 17 recommendations from the working team that was presented to the Home Visiting System Committee and then adopted by the Early Learning Council to serve as guideposts and goals for transforming the home visiting system. Next slide. In March of 2023, a home visiting system ad hoc planning team began monthly meetings to align funding and support the launch of a home visiting system coordinating center. In June, based on the planning team's recommendation, the ELC Home Visiting System Committee selected Portland State University's Center for Improvement of Child and Family Services to house the Oregon Home Visiting System Coordinating Center. So the center got established at Portland State University. Dr. Green Beth Green in August of 2023, the lead for the Home Visiting Coordinating Center, worked closely with the Home Visiting System Committee and the planning team to develop and fund. And this is really quite remarkable. You always kind of dream of that we'd be able to actually do a job of blending funds with philanthropy, but also with the different state agencies to fund years 1 and 2 budget for the center, which will include 2 transformation managers to work at the state and regional levels. Next slide. And that's someone else's, I think, but I think that's someone else's.
Well, there are too many words on there to read, so I think it's gonna be, those are sort of the entities that are very involved in making this coordination center work.
Yeah, the collaborative I mentioned before, which are folks from multiple agencies that are working on developing the system. We have the steering team, which is really focused on how do we support the development of the coordinating center, the Home Visiting Committee, which Peg and I are co-chairing, and of course our Learning Council. We're all responsible for developing this system. Next slide.
I think I've got the next one.
Woohoo!
So this is included in your packet. There's a summary of, oops, that's one page too many, excuse me. The Home Visiting System Committee met about a week and a half ago, and we welcomed some new members. Ruby Ramirez, who is now, luckily for us, a member of this committee as well, of this council. Peg King, and Peg represents CCOs, and Kelly Thorne Ladd, who we all know well, who has been a member of this committee. Robin Hill Dunbar and Pamela Ferguson are joining the committee as liaisons from the steering team, that whole committee scheme that you saw the last time. At that meeting, we discussed several kind of priority recommendations that would sort of guide our work for 2024. And today we're going to review those, and after reviewing those, we will ask for the Early Learning Council's formal approval of those as the focus for the Home Visiting Systems Committee for 2024.
So Gabby, why don't you advance the slide? We need to roll through this a little faster.
Okay, so included in your packet are a summary of the full 17 recommendations that we all approved about a year ago. And we identified 6 priority recommendations of the Home Visiting System Committee that we selected that would be our priorities. There's considerable overlap with these, and they're referenced in your packet. The first one, building the collaborative culture, we want to build on relationships that take advantage of the relationships that are already established in various communities, and support the foundation and connections across various programs and agencies. The second one is to support the funding. This is really, we'll discuss the budget a little bit later, and Beth will be able to do that. But really the goal is to finance the initiative. The third and fourth recommendations include expanded governance and leadership. And this is really to improve and streamline and coordinate home visiting advisory structures, and expand involvement with tribal and culturally specific programs and partners. The next is the shared framework and vision. And we really want to create an equity-centered home visiting vision and framework, and some strategies to outline outcomes for governance, financing, workforce development, communication, quality improvement, and intake and referral. And lastly is recommendation N, which involves systems and data, as well as some quality improvement, developing ongoing involvement with involving collecting data and quality improvement. The added one that we really focused on was some family voice, and wanted to get that involved early in the process rather than later, and to take advantage of some of the structures that were already in place involving family voice. And next slide. I think, Beth, I think you have that one.
Thank you, Peg. Yeah, so good afternoon, everyone. I'm Beth Green from Portland State University. I'm honored to be here, and even more honored to have been selected to lead this exciting work as a program neutral backbone for this home visiting system coordination work. So I'm going to provide a little bit of information about the center, where we are, timeline, and our plan for moving forward. And I think there's been some materials, a one-pager sent to you as well in your packets. So just a really quick overview of the center. As Peter articulated, we were selected back at the sort of the end and middle of summer and have obtained funding. Our key role is to provide capacity, by which I mean staff resources. Collaboration takes time, as we know, and evaluation and data resources, as well as resources for connecting people and bringing convenings and bringing programs together. We're currently in the process of hiring our 2 systems transformation managers. Those positions are open, so if you know anybody, please send them my way. We're also bringing our experienced home visiting systems evaluation team and hoping to launch the center officially in January. So we're very much still in the lead up, ramp up, getting our arms wrapped around the work and figuring out what our priorities are. Next slide. So just a little bit about our approach. First of all, we are, I think one of the reasons that we were selected is because of our experience, the team's experience both in evaluating and partnering with home visiting systems transformation work that's been led in several Ford-funded regions across the state. And we've been doing that for about 8 years, as well as my own background of many, many, many years before I had gray hair, of sitting at various home visiting program evaluation tables, policy tables at the state and national levels, and really bringing a lot of experience around starts and stops in building this home visiting system over the years, and hoping to build from that experience as we move forward. Our approach is really building on those experiences, and what we learned are we really need to, first of all, center relationships. You've heard this about before, and really expand those relationships and lead with equity, expanding the tables of leadership, advisory, and systems visioning to include culturally specific programs, tribal programs, and other community-based home visiting program is a key goal for us. Similarly, engaging family leadership early in the process was something we learned from experience we really need to do in order to have families not just telling us what's wrong with the system, but helping to create solutions. Secondly, or thirdly, we want to make sure we're keeping what's working. This is a mantra for me. I don't want to be recreating wheels that are already out there and creating systems change, but identifying and building on what's in process. There's a lot of great coordination and systems improvement work that's happening especially at the regional levels, and we want to leverage that and make sure that home visiting systems are part of those conversations. And then finally, really supporting each and every step. One thing that we've learned is the systems change takes time. That's no surprise to anyone in this group, but it's really important to support and learn and celebrate from the steps along the way and show people that it's worth coming to the table because you actually are creating change. Next slide, Gabby. So this is just an overview. I won't go into detail because I know our time is limited of some of the key tasks. So we are working alongside and in support of the Home Visiting Systems Committee to really move forward in terms of the priorities that committee has identified. We'll also be working with the Home Visiting Collaborative on priorities that they've identified, all based in that long list of 17. So we see our work as providing staff support and opportunities to move towards that collaborative culture to really address some of the longstanding competition, turf issues, other things that are out there and need to be named so that we can bridge and create a sense of collective shared purpose rather than separate siloed home visiting programs, each working independently. We're going to be doing a lot of support for governance, a lot of development of this shared vision. This is something that has been a real touchstone for our Ford family work, was to have a well-articulated but always in process model showing what strategies we're implementing and why, and how that's going to get us where we need to go, as well as collecting data along the way about how to learn that. And then adequate financing. I'm going to talk about budget in a minute, but supporting the Home Visiting Committee to work with agency partners to get those cross-agency investments. Okay, next slide. Action is going to be a big part of our year one tasks. So we're going to be, as I said, really trying to learn about the landscape of home visiting and systems coordination. So trying to develop family leadership by identifying and mapping where family leadership is already happening and where home visiting systems work is at the table. Identifying and mapping home visiting programs. There's one of the things that we've been asked to do is just to come up with a list that would provide a comprehensive overview of all of the various state, federal, local funded programs across the state so that people would know all the things that are out there and available. We also want to map coordination and cross-systems improvement efforts because there's a lot of those going on right now. Regionally, there's home visiting specific efforts like Family Connects. There's our early learning hubs. There's family preservation systems integration work out of ODHS. There's other work. Upstream Initiative is a new one that's coming online. So lots of coordination work. We don't want to make a siloed home visiting system coordination system. We want to integrate it into what's happening already. Professional development and that mapping out where there's opportunities to support the workforce, which is a critical need in early childhood and in home visiting. And then, of course, the data systems and working to begin the challenging work of integrating those and making life easier for people in the field around data. So we'll also be collecting data on the system. So hoping to collect some outcome indicators that we've learned and used from our Ford family work of what does it look like? How do we know if we're changing the system, and how can we make sure that we're collecting data along the way that shows improvement, or if it doesn't show improvement, learn along the way. Okay, next slide. Again, won't go into this. This gives us you a little bit of timeline. I'll give you broad strokes overview. So as I said, right now, we're doing outreach and really trying to engage more culturally specific tribal home visiting programs in our advisory and leadership structure. We're really trying to work on the budgeting piece, which we'll talk about, and doing our hiring. So trying to get staff on board so that we can launch get everyone on board and running as of the first of the year. Then we'll be doing our mapping, compiling existing information, continuing to support convenings, and again, working with regional state partners to develop relationships and create platforms for co-creating solutions to the home visiting systems issues that have been identified. We'll be making some recommendations, compiling our data as we collect it, and then coming up at the end of the year with a landscape across all of these different pieces of the system and recommendations for what needs to change, which will then drive the work moving forward. Okay, so that's year one.
Wow.
Piece of cake. And so I think the next slide goes to budget. Sue, did you want to add anything? You've been so supportive of this work and creating the vision and helping get the pieces going.
Well, I think a piece that will be really well received by the council is your focus on research and data and systems building. Looking at what are the outcome indicators and doing that at the beginning instead of when we're halfway through the process. So, and that's one reason that we selected PSU as the center for this, is because they're known for doing outstanding research. And they already know a lot of the partners in this field, more partners than I know for sure. So we're not starting from ground zero. We're really starting way along the spectrum of relationships and knowledge about what is happening in home visiting in the state. And really the reason this got started, and I know Kate Wilcox is on this call too, OHA and DELC, of course, have some of the most expansive home visiting programs. And they both came to the council and said, we've got these great programs operating all over the state, but there's no coordination of them. And families have a really hard time of figuring out which program should they look to, or what are the programs even as options. So it was really OHA and DELC who took the lead and said, we need to have the council play a role in pulling this together so we have a system instead of just programs. So that's how we got here. And as I say, we are so fortunate to have Beth and her team providing the leadership in this. And when we look at the budget, which is the next slide, you'll see, and I think Peter mentioned this. Gabby, why don't you go to the next slide? I think Peter mentioned, one of the assets that we already have is the public-private partnership in this. And we all talk about that a lot in different venues and different roles we have. But here is a very real, tangible example of how that's already happened. And we had to have this partnership in order to even launch this initiative. And I want to thank the Ford Family Foundation and Robin Hill Dunbar, formerly Ann Kubich, for stepping up and saying, we're in. And we're going to help launch this. And then, of course, OHA and their McBee funding was a critical partner. So we can talk about the budget in more detail, but I just wanted to give you that background that this is incredible that we have gotten this far in a relatively short amount of time. And do you want either Peter or me to walk through this budget? Would that?
Either one, or I can do it, either one.
Okay, well, Beth, if you want to go ahead, and then Peter and I can chime in.
Yeah. So this is a high level budget, obviously, doesn't provide detailed costs, but to give you a sense of sort of where we are right now, this is funding the two full-time system coordination managers or transformation managers who are going to be leading the work. One will be focused at the state level and one at the regional level. It also funds our small but mighty evaluation team so that we can continue to collect data to really be able to reflect progress and learn along the way. It also includes the budgets for what we found to be so important in our Ford family work, and I think we all know in our bones is true, which is support for people to actually meet in person, to come together, to do in-person relationship development, but to develop trust through shared work and bringing people together in person. So there's money in the funds for those convenings, those travel funds, and the support that we need to provide to community providers when we ask them to come to the table and engage in these kind of processes with us in order to be equitable. So we have investments for year one. Year one, we've aligned this with the McVie federal budget, since that's our biggest source of funding at the moment. So we'll run January through September and then be on a September to October fiscal year. With McVie funding as the predominant source of funding, we have secured investments. Thank you, Kate and OHA, for working with your McVie federal funders to provide that support, at least for the first 2 years, and hopefully for several more years after that. And I'll let you talk more. I think I at least understand that McVie can't continue to fund this in perpetuity. We also have Ford family funds committed for 2 years and then hoped for in the future, the next biennium. We have work to do, I think, in terms of cross-agency investments. But you can see here, we've almost got enough for our first 2 years. We have what seems now like a relatively small gap of about 122,000 for that second year, because that's a 12-month year. So I think that's going to be hopefully a priority that Peter and others in the committee will be working on to try to secure some investments for that, as well as then securing funding for the subsequent biennium, where we'll also be adding capacity for those regional coordinators. That really reflects what my takeaway was from the Home Visiting Systems Committee, which is the importance of creating a state system that can support regional level coordination where it really happens on the ground. So additional resources for regional coordinators, similar to the ones that Ford family has funded in 4 Oregon hub regions right now. So that's the budget. Also to say those regional coordinators do not have to live at PSU, but what's important is to secure the resources that are going to allow folks to have home visiting and those incredibly important services and systems for pregnant families and families with children with infants and toddlers, right? That's the focus of home visiting, those perinatal and early childhood days. But to have those resources for that regional coordination, so those littlest ones do not get forgotten in the focus on older children and childcare needs. So that's how I see the budget. And I think, Peter, I think it's to you.
Well, next slide, please. If we have one.
I think the next one is just, are there any questions?
I think that's that is the wrap up. Just appreciate everybody's work, Beth. I really appreciate your work on this, and the collaborative has been essential in helping to shape this and move it forward. Kate, thank you for everything you've done to move forward on this too. I think a lot's gotten done in a fairly short period of time, but we really have to keep the momentum going to develop the system and make sure it works in every region of the state.
So Gabby, will you put the budget slide up again, please?
Yes, give me one quick sec.
Council, what I'm hoping is that we today will have a motion and approve this budget so that the committee approved this a week ago, I think is when the meeting was, to send to the council for our review and our approval, recognizing that we're going to learn a lot more over the next several months, right? As Beth launches this coordinating center. So the 25-27 budget may look different over the next several months, but we need to start laying the groundwork with legislators and agency partners as far as the 25-27 budget request goes. We've got to start now to start building some support and momentum for that. So I just wanted to throw that out there and see if there are any questions about the budget. And I see Robin's got her hand up, but just wanted to hope that we can get to that point today. Robin.
I don't have questions other than to say, thank you, Beth and others, for sharing this important work. It's been a passion of mine and ours at the foundation for the last 8 years, and our commitment has been in the communities. And so for this opportunity for a public-private partnership is just exciting. I know that it will have an impact for families. And when I think about RUACT and Early Learning Council and this amazing state that we're in, where we have this shared strategic plan of working together, it's really phenomenal. But when I think about this project, I think this is an example and a place for us to exemplify or show, put into practice the partnerships of working together for families with all of these amazing state agencies who support families in this way, to come together to collaborate and coordinate on behalf of families. I know that the work we've seen happening in communities is just a game changer for communities accessing services and understanding how best used funds, shared professional development, and all kinds of bright stars that have come from this work at the foundation. It's been very inspiring. So I just can't say enough about it and how excited I am that Beth and her team will be leading it from the center. It's just great. Thank you.
Robin.
Thanks, Robin.
Does Robin want to make the motion?
That would be great.
I do.
And then I'm going to go to Kate. Oh,
okay,
Gabby.
great. Yeah, I just wanted to make sure that we saw that Kate's hand was up. Okay,
Yes.
great.
Okay, Kate, how about your comment, and then we'll look for a motion.
Yeah, so I get to dovetail off of Robin's private sector perspective to the public sector perspective, since this is a private-public partnership, and it really is. I mean, I think what Robin has described is really like how this works. I've been at this job for 16 years, and this is like a dream come true for me. We've been hitting our head up against this wall for a long, long time, trying to figure this out. And meanwhile, the Ford Family Foundation really piloted what this could look like and really led the innovation that now we can take to scale. And I just think that that's really, that's just the beauty of this kind of where the foundations have the flexibility to be innovative, and then the public sector can come along and take it to the scale that we need to. I will say I'm honored that our maternal, infant, early childhood home visiting grant, it's a federal grant that we get, is able, and part of the work is systems work. So we were able to contribute to really kind of help jumpstart this. We're looking forward to the other sectors really putting their fork in the sweet potato pie, because we all need to eat from this pie in order to support the families. It's really critical that, because as we heard earlier, we know that ODHS has home visiting, ODE has home visiting, DELC has home visiting, OHA has home visiting, and then there's the home visiting that's not in state agencies, that's even, that community-based efforts and initiatives that we really want to embrace and bring into the fold. So it's really, really important. And what would really solidify this even more, this is just my little pitch, and this is where we're heading in that 25 to 26 is helping the legislature join us and really helping us to resource this, because that's what's going to make this sustainable, is if we get the state general fund dollars that carry this forward in perpetuity. And it's not a huge investment for, I think, a real big bang for the buck. In terms of what we can do for families. So that's my public sector pitch.
Thank you, Kate. We would not be here without Kate. I just want everyone to know that. And this is super exciting. And just so you know that we've got all of these state agencies, all 4 of these, plus we have housing on our Home Visiting System Committee on Peter and Peg's committee. So we are well positioned, and we're working with ODHS and ODE right now as far as looking down the road at funding. So the agency partners are involved and integrated in this. So sure, I would love a motion from Peter or Peg or Robin or whomever.
I think we should let Robin do it.
Okay.
As long as I say it right, you have to help me. I do motion to approve this budget as it has been put forward.
And who would like to second that?
I second that motion.
Thank you, Sue Ben. So discussion of this preliminary budget, I think, is the way to look at this. Hearing none. Let's just do a raising of hands for those in favor of this motion. Will you please raise your physical or virtual hand? And thank you. And any opposed to this motion? All right, we have a budget approved. Thank you very much. Can we go back, Gabby, to the slide that has the recommendations on it? Because that's the other one that I'm hoping the council as a whole will endorse. The committee approved these at its meeting a week or two ago. And they're, it's culled down. It's sort of the top priority recommendations for at least the coming year out of the 17 or 18 original ones. So nope, it's not that slide, Gabby. It's another one.
The next one.
Nope.
Keep going.
Keep going.
Well, that's
no, the other way. Oh, does Beth, do you? Oops. Sorry.
Then keep going, yeah, Gabby. It's one of the early ones.
Okay, great.
There you go.
There. Thank
Awesome.
you.
Thank you. Thank you.
Okay. So this is the other one I'm hoping the council will also endorse. That this is where we want to have the committee and the coordination center focus, at least in the coming year, knowing it'll take a long time to get there. Is there a motion to accept these or endorse them or adopt them, whatever word the person would like to put on it? And Peg or Peter, Barry, go ahead.
Yeah, I move that we endorse / adopt these recommendations as presented to the council today.
Thank you, Barry. Is there a second for that?
I will second.
Okay, thanks, Angie. Any discussion about these recommendations? Hearing none. If Gabby, you can put us back on the screen again so we can do all those who support this motion, please raise your hand. Thank you. And is there anyone who is not supportive of this? Okay, we're good. Lower hand. All right, it is 12:59. Well, council, thank you. I want to thank Beth and Kate for joining us for that part of our meeting. We're very, very excited about moving forward with this initiative. And Peg and Peter, want to thank you again for your leadership on the committee. And Ruby, for your joining the committee, as if you didn't have enough to do already. And Robin for co-chairing the steering committee. This is all very integrated here. All right.
Thank you for having me. Thank you, Sue.
Thanks, Beth.
Thank you so much.
Thanks, Kate. Okay, so let's move on to the, I have to grab my next set of papers here. And we'll move to the public hearing that we're going to hold. Motions, sorry. you too many papers here. All right, so council, this is the part of our meeting where we will be considering the adoption of rules that affect childcare in the state. And there are a lot of these to be looked that we're going to look at and consider today. And just to let you know, there will be a lot coming in the future as well. So setting rules so that everybody understands upfront what the expectations are in childcare to keep children safe and healthy is a super responsibility of this council. So that is what we will begin today with this new composition of the council. I'd like to, Gabby, I think you have people who have signed up to speak.
Yes.
Okay,
And-
council, as you know, we've got 5 different rule sets. So we have received public written testimony, and thank you to everybody who submitted the written testimony. We appreciate that. And then we have some people who have signed up to speak at our meeting. Because of the number of people who have expressed an interest in speaking, and because we've got a lot of discussion among council members about these rules, we are going to limit testimony to 2 minutes apiece, which is what we always do, but ask you to just give us your thoughts about the rule sets that are in front of us.
Yeah,
So
and
Gabby.
let me admit there's a couple people in the waiting room, Sue. So give me one quick sec. We had several folks reach out to provide verbal testimony. Marissa's here to also kind of just help keep an eye on the waiting room in case more people join in the meantime. But for now, we do have 2 of the 20, as Sue mentioned, right, due to the influx of requests that we received, we are going to limit the folks who are here to provide public testimony to 2 minutes. I will keep time, and I will come off mute and let folks know when there's 30 seconds left, and let you know when your 2 minutes are up, and then we will be moving on to the next person. Given as there's only 2 people so far, I think we can just go through, and I think I saw Annalise, if you want to start. And I do also just want to remind those who are here to provide public testimony that since this is a listening session, we won't be answering questions during the hearing. But if you have any additional questions, you can send them to me at my email address, which I'm happy to drop in the chat in just a moment. And we will follow up with you. And also just want to note that the meeting will be recorded and it is being live streamed.
Hey, Gabby, did you happen to notice in your DELC ERDC document that I have before me that you guys included the rule language and the charts for the payments, but not the changes from 2468?
Are you talking about the slides or the
Nope, the council action report, employment related daycare, has the proposed rules just as the other ones do. So all the reports, the council action report requests all have the rules written in them. And this one has the rules written in it, but doesn't include the 2468 changes. It only includes the changes to the payments, not the 9%.
Okay, and I'm wondering if, I know that I was updating those up until last night, so you might not have the up-to-date ones that council members received, Annalise, and I do apologize for that.
Because that's off the website. So
yeah,
and it does say that that it was amended due to union action, but that's not available. Do you happen to have something that I can look off of really quick?
Let me see.
Because I pulled it off the ELC website at noon today.
Okay. Because we've been making updates. And it's specifically for the rules, you said?
It is for the employment related daycare late payment and rate increases. It is the 2468 stuff on the 9%. Those rules are not in this request for action. So were they removed from action? Are they not being taken up today?
Okay. Annalise, while I figure that out and try and get you the correct council action request, we do still want to continue with public comment. So let me move to Anna, and then Anna, I will go ahead and still keep time. And then I will look for the information that you're looking for, Annalise, and get that out to you.
Okay, well, I can still talk about it. I just may not be good, so.
And Chris can maybe help with this as well.
Perfect. Okay. So Anna, if you will please state your name. State your name and it for the record and any organizational affiliation.
Yes, my name is Anna Pickell. I am a certified family childcare provider at Happy Go Lucky Childcare in Southeast Portland. So do I begin my testimony now? Okay. So thank you, council members, for allowing us the chance to speak at this meeting. I've been watching you all morning, and I specifically appreciated the introductions of the new members, Barry, Ruby, and Marie, and their commitment to advocacy in their personal jobs and within this state. That is something that childcare providers absolutely need more representation of, especially on the Early Learning Council. So unfortunately, the rules that you are going to be discussing are causing some severe mistrust among childcare providers with our state, our licensing agencies, and DELC as a whole. I have heard over the past number of years from many people on this committee how essential childcare providers are, how important we are to having a robust economy in our state. Yet, unfortunately, rules continue to be discussed and passed that harm small businesses and childcare programs. Specifically, the rules that you are going to be hearing about later today, the rules with the ERDC program, potentially some of them have been changed, but they are putting a significant burden on small businesses. We have been carrying the state of Oregon's mistakes for 30 years, and it is time for that to end. As David mentioned earlier, we have collective bargaining rights with the state, and these rights were bargained in our last bargaining session. It is a complete slap in the face to all of the members of that bargaining team for rules to then be created that circumvent everything that happened during those many, many months of bargaining and the contract that was already signed and agreed upon by the state of Oregon. There was a huge issue just 30 days ago where
Anna, you have 30 seconds.
Every single billing form was mismailed out to people. We are also having our constitutional rights violated by the child care facility rules that are attempting to be passed. DELC should not be allowed to be the judge, jury, and conviction when it comes to violations of potential child care rules. We absolutely need these to be revised and reviewed before they are voted on. Thank you.
Okay, and we are at time. Thank you, Anna. And Annalise, hoping you saw in the chat that the language is on the top of page 5 in the amended ERDC.
Yeah, it's not there on the copy that is available on the website, but that's fine. I'll just talk about it and we'll just see what people think. So are you ready for me?
Yes, go ahead. You have 2 minutes.
All right. All right, please do not pass this rule set unless or until you've read the public testimony submitted by our union. We want to just talk about that AFSCME did participate. I participated in the rule advisory committees, did not feel like those were very effective or helpful. Gave a strong voice to those concerns. Wasn't until we provided written testimony that some of those rules were changed. House Bill 2468 was our bill. It was our concept. We took it to legislators to get it passed. There was never any intent that as far as the rules around the ERDC 9%, that the state could basically administratively rule that the Department of Early Learning Care could create administrative rules, basically giving them a jail out of free card, and it supports our collective bargaining agreement that those exceptions are in there. We would accept, or we do believe that if there's a state worker strike of the bargaining units that work in that and do that work, that would maybe be an exception. And then if the state government shut down, absent that, the state needs to be accountable and DELC needs to be accountable for late billing forms and late payments. The language was not in the packet, so I can't really address it. I apologize. Of course, we're on board with the rules. We do believe that with the general rules for all facilities, that there should be a rule added in this, that all of these rules that are adopted under 414075 must be included and printed in the rule book for all different facilities so that they have those copies in the rack. The DELC discussed that these were supposed to be public and they wanted them to be transparent, so then they need to be in the rule book. So we'd ask that you create a rule and add one line
You
about
have
that.
30 seconds, Annalise.
Yep, thank you. The issues here are, this 2468, this investigative stuff was stripped by DELC from our language bill. The bill was not going to pass without it. And now they're using it instead of accountability for DELC staff, they're using it to hold us accountable as childcare providers. There's a couple rules in particular, again, that's all in the public comments. And I think you should read those public comments before you pass this prematurely.
And you are at time. Thank you, Annalise. Marissa, did anybody else join who had signed up on the list?
I'm not seeing anybody else right now.
Thank you. So with that, Sue, not sure if you want to go ahead and close, or I could just go through the list and announce the names, just so that we had noted that, you did register to testify and that they didn't or aren't here. Everyone was notified that if they couldn't make it, they could still provide written testimony to me directly. So we did send those additional instructions as well in case folks knew that they weren't going to be able to make it. So in addition, we also had Hadir Saleh sign up for verbal testimony. Not here. Nicole Arenas Redinger. Jorge Arenas Montero. Alicia Sanchez Matrick.
Gabby, just keep reading through them if they aren't in the waiting room.
Perfect. Jan Robinson, Ada Echeverria, Brianne Wilson, Anna Rivera, Mary Perkins, Amy Hanna, Sherry Williams, Brianne Shepard, Anna Piquel. Oh, Anna, you already went that, so scratch that. Corey Lynn Neal, Jennifer Herrera, Stephanie Richape, Felicia Van Loo, Heidi Lawler, and Karen Bailey. And Elaine Home was also registered, but she indicated that she was not going to be able to make it.
Okay, thank you, Gabby. All right, so nobody else is in the waiting room, I trust. So we did receive written testimony from everybody you just listed, correct, Gabby? And other written testimony, and those are on the website, are they?
Those have not been posted yet, but they will be posted after the meeting.
Okay. All right. And I think I speak for the entire council when I say that we are looking at these rules very carefully. We have read the testimony that was submitted by the union, all 22 pages. And we also read thank you, Annalise, for preparing that. And then also the one-page testimony that several providers submitted as well. So we are aware of what some of the issues are that you presented. So what we've asked staff to do is we're going to go rule set by rule set. And I've asked staff if they would, make opening comments and tell us a little bit about the background of the rule and, respond to any of the questions or concerns that have been raised in the public testimony, and give us that overview. So I don't know if Chris is going to start or Alicia, how you want to do this.
You'll have Alicia start.
I can start, absolutely.
Okay, so just be sure to introduce yourself
Of
for
course.
all of us? Thank you, Alicia.
Absolutely. Good afternoon, Council, Chair Miller. Thanks for having me. I'm Alicia Gardner. I am the Director of Child Care Licensing Division. I want to flag for you that I do have some slides available in response to some of the public testimony that you all have received. And I will note that they are different than what is in your packet based on some edits that we have applied today. Gabby, I'm wondering if you are able to share screen. And while you are sharing, I will begin with, in just response to Annalise's testimony today, we absolutely intend to ensure that providers have access to this rule set and a printed copy available to them. I wanted to talk to you about the rules that we're bringing to the council for your consideration for vote today. But before I dig into some of these rules, I just wanted to kick off the information that we have for you to explain a little bit more about our findings, enforcement structure, the contested case hearing process, and why these rules are so important for transparency and consistency to our process. I want to begin by explaining that decisions regarding compliance, observed noncompliance, and issue findings are not made by any one individual in the agency. We have a series of checks and balances that rise all the way up to the court system to ensure that providers are getting a fair determination on whether noncompliance has occurred or not. I want to remind the council that while some violations are minor and the majority of them can be corrected, and the majority of programs learn from mistakes and correct their violations and move on through their business, we do actually and truly do deal with violations that are very harmful to children. Our charge as a division and our statutory authority as provided to us by the legislature is to create and inspect for requirements that are intended to protect children while in these childcare settings. While we care deeply about the industry, we've tried and we try every step of the way to get providers on the correct track to keep them open and keep them successful. The fact remains that we do manage and investigate abuse and neglect, and we do those in tandem with Office of Training, Investigations and Safety with Otis, and abuse and neglect does occur in childcare. And the agency does need to be able to respond quickly to protect children and families when this evidence comes to us. We also know that while many violations are not nearly as harmful as that, our system is designed to provide providers to get on that correct path. When the decision comes to my desk to revoke or deny a facility, I expect evidence from my team that we have made every attempt to get a provider on the right path prior to pursuing legal action. I have worked in the childcare field, and I have worked in family childcare, and I have worked in center care. I have seen in my work, in my career, childcare closed down due to failures in a broken system. And I understand that childcare licensing has a role to play in all of this. These decisions are not taken lightly. My team does not take these decisions lightly, and we intentionally hire individuals who are passionate about this field and have worked in it whenever we can. Unless children are in imminent danger or we have evidence of an abuse and neglect, you're going to find that childcare licensing has done everything from technical assistance to warning letters to intermediate sanctions such as civil penalties or conditions, which restrict childcare operations in specific ways to get that provider back on the path to success. I have some additional information to provide to you about, on the record, just about our processes and how that actually looks within our space. Next slide. So these rules that we're bringing to vote today apply to all facilities, which include centers, family childcare homes, exempt providers, recorded programs, regulated subsidy programs, and those who may be conducting care unlawfully. This rule set is unique to CCLD in that it covers processes and policy which govern how our agency proceeds, and rather than relying only on our internal processes, codifying the agency's practices and procedures in rule will ensure consistent practical application by CCLD staff, and it will provide clarity to providers on how we proceed within our investigations. In bringing forward these rules to vote, CCLD will be able to provide transparency and a roadmap for providers and the public and families in understanding how we proceed in very important matters such as investigations, tandem investigations for abuse and neglect, unlawful care investigations, or procedures from when an individual is prohibited from providing care. The processes in the proposed rule relating to investigations and complaints are processes that are already in existence today, and codifying them into rule will promote that consistent application. While these rules are new, the practices and procedures in which CCLD has put forward to you for vote are not new. Other than the changes that we are putting forward as a result of recent legislation that has just passed. So in these rules, you will find in the apply to all rule set, some new policy procedures and concepts, which are a product of House Bill 3558, which passed in 2023 at the state legislature, and House Bill 3073, which covers union representation at contested case hearings. Rules provide guidance to both providers and agency and staff. While many of our rules are related to health and safety on what a provider can, must do, or must not do, the rules for an agency are also a best practice and provide procedures for an agency on how to proceed. Some policies are rules if they meet the definition in the Administrative Procedures Act. For example, DELC's current complaint policy is a statement how DELC is interpreting the authority granted by the legislature for illegal care investigations. Therefore, it is best practice that these matters be in rule. Moreover, the practices and procedures in rule will ensure consistent application by CCLD and provide consistent application for providers. Next slide, please. So I want to begin by explaining that these decisions regarding compliance, observed noncompliance, and issue findings are not made by any one individual. We have a series of checks and balances, as I've stated before. Providers receive full due process with notice and opportunity to be heard, as well as options for judicial review in either circuit court based on the record made in circuit court, or for findings and other in other than contested cases, and before the Court of Appeals for contested cases. The system reflects an intent that issues with respect to licensees be resolved, and at least initially before the regulating agency, which is us. It's a process that promotes consistency. So I wanted to run through you just a little bit about our process, and this is from the beginning. When a CCLD staff issues a formal letter of noncompliance, you can see here the steps in which that we review and approve those findings. A single complaint finding would not be a basis for legal action on an individual's license unless there was evidence for children being in imminent danger, such as in cases of found abuse or neglect. CCLD tracks the finding that we have made to ensure corrective action is completed by the provider, giving TA along the way and support. And we also ensure that that finding is corrected. Next step, next slide. So unless the facility has closed before CCLD is, so this is some rule language that is in vervote for you today, just so you're aware. This rule language reflects our findings. These findings are not new. In what actually we have put in is related to so when a complaint, so to our complaints. So when a complaint comes in to Child Care Licensing Division, we are obligated to make a finding on the allegation. That system is a CCDF requirement. We are required to have a complaint system for our federal funding, and we are required and obligated to investigate any and all regulatory complaints that come to us and create and make a finding on those allegations. When we receive a complaint, we do know that our most serious and harmful violations often come to us through the form of somebody who's observed it that is not the inspector of the agency. So the most serious violations do come through in the form of complaint, and we are obligated to make these findings. Some of the information that came through in public testimony relates to the reasonable person standard. So I wanted to just talk about that for just a moment. More likely than not is a preponderance of the evidence standard. That is the standard that would apply to noncompliance alleged as a basis for legal action, such as a revocation of a license or denial, or even an emergency order of suspension. In those actions, a judge will determine if the requirement was more likely than not violated, which is that preponderance of the evidence standard. This is a difficult standard for laypersons such as CCLD staff to apply, and can involve very nuanced analysis of credibility and other factors. The reasonable person standard being adopted or being up for consideration for vote more closely fits in with what CCLD staff are able to do, and is the exact same standard that child welfare staff use in their abuse and neglect assessments. This supports that if a reasonable person believes a rule or statute was violated, as a found in a can be made a valid finding. This can be posted on the portal and reviewed for further legal action. The provider can post a response and seek a findings review, as well as judicial review of the finding, regardless whether they have challenged the finding before. If it is used in a legal action, provider can argue that there is not a preponderance of the evidence to support it. This ultimately increases child safety by making available information about noncompliance that a reasonable person would conclude occurred. Next slide. And this is just a little bit more information. I won't go too into depth on this in the interest of time, but this is the contested case hearings process in which all providers have the right to, should CCLD issue a notice or a proposed order of legal action on an individual's childcare license. So as you can see, there is a full due process available here, and these rules do not change that. Next step, or next slide. And just a little bit more information on the findings review process. This is our internal process in which any individual is able to contact us if we have made a finding, and we will review internally. And we have 2 levels of findings reviews in which managers and directors both can review the finding prior to a judicial review if a provider still does not agree. And so these rules will support that process and will not change this process. We do ensure that our findings are fair and consistent, and we are working very hard every day to at all levels of the agency to ensure that we have conducted a fair investigation as well as a fair determination on the findings. Next slide. I think the slides may have gotten a little mixed up, but here is just some more information on contested case hearings. So next slide. Lastly, I just wanted to note for the council that I have been here before talking to you all, and for the new members to understand that we are in the midst of a major enforcement revision to our structure and how we will enforce rules in the future. So right now we are working through a project called risk assessing each and every single rule. That risk assessment will will analyze and determine for us what is the actual risk of harm that would be caused to a child or potentially caused to a child should that rule be broken. So in taking those risk assessments to each rule, and also considering the number of violations per visit, as well as the combinations of risk in the different violations, this will create a framework that will ultimately provide a more consistent and transparent approach to our enforcement, reducing that ambiguity and ensuring fair treatment for all childcare facilities. I want to also note note that our goal is to couple this with demographic data. So we will be able to identify and address disparities and inequities in the application of these regulations, and also allow us to analyze the impact of enforcement practices in different demographic groups. And that will facilitate policy adjustments as needed and promote equitable practice. I will also note that this is also going to set us up for success to ensure that all childcare facilities are held to the same expectations, regardless of their location or community. And this promotes healthy and safe childcare environments for all children in care, regardless of their neighborhood or socioeconomic status. This also will give us opportunity to identify which communities need more technical assistance in areas versus others, and that is extremely valuable. So we can target training and technical assistance to help providers be successful with these rules. Next slide. So lastly, to wrap it all up, these are the sections that we have in the Apply to All rule set for you all today. There's two different types of rules folded in within this rule set. House Bill 3073, which passed in 2021, and House Bill 3558 are legislatively mandated sections of the rules which cover those topics related to operating hours, the definition of childcare, as well as interference of investigation, which is now prohibited. And then also union representation at contested case hearings, which were temp rules that we passed that we're now bringing to you for permanent. The other sections down in those 3 bullets are not new to the agency, but new to rulemaking. And these are common practices and procedures that CCLD engages in every day that we are bringing to rulemaking for best practice. And next slide. We did make some changes as a result of the public feedback. We had 3 RAC meetings held in October of 2023. And we did in that RAC add definitions for contextual understanding, as well as plain language practices where it could be without changing the legal meaning. And there were no indications of fiscal impact in those meetings. Next slide. As a result of the written feedback we received and you have received, we've removed rule language regarding recordings during an interview. We've clarified the differences for union representatives and attorneys during contested case hearing process. And we also removed rule language limiting union representative communication with CCLD on behalf of the provider. And that's what I have for you on the rules to all.
Okay, thank you, Alicia. Wow, a lot of information there. So Council, I'd like to open it up to questions and comments on this rule set, which is the first one in our packet. General rules for all facilities and labor union representation in contested case hearings. Questions or comments?
I'll go first, Sue.
Yeah,
Oh, sorry.
Angie.
I didn't see that Peter had his hand up.
Oh.
Angie, I talk too much. You go first.
All right, sure. I'm not agreeing with you on that one, but yes, I'll be happy to go first. Thank you so much, Alicia, for that really, really helpful overview. I did have a lot of concern after reading the public comment, particularly around due process and around the investigations. So I really appreciated hearing more about how that process works, that there are opportunities for review and judicial review if necessary. So that was very helpful to me. Also had some concerns around investigation as well. And I didn't hear as much about that in your presentation, but just I'm curious about how, the percentage of investigations that are found unable to substantiate. And I think that unable to substantiate is maybe not as devastating as a valid finding, but it doesn't resolve much, I would say, for the provider. So just curious about that the training that's provided to investigators, but I feel a lot more confident. I really appreciate the information that you shared with us. Thank you.
Absolutely. Sue, do you want me to respond?
Sure, let's do
Okay.
this one at a time. Thanks.
Absolutely. Angie, thanks for your question. I also wanted to bring in some additional information for investigations, but knowing that we were limited on time, I'd be happy to come back to council and talk to you more about our investigations process if you like. But generally speaking, I will say that we hire trained investigators, typically those with experience. We know that when we show up for investigation, this can be very hard on childcare providers. And we work pretty hard every day to ensure that we are doing the right by providers, in that we're developing rapport. We're giving them every opportunity to take care of children, knowing that we have to show up unannounced to get eyes on the facility, particularly when we've got very serious allegations. That's just part of something that we have to do. But we are working very hard to ensure that we are understanding that this is interruptive to providers' days, and knowing that they have to take care of kids, and also that we have to leave them whole as best as possible once we leave. And that can be very stressful on the provider, who has to then go take care of children afterwards. I don't have the percentages of unable, valid, invalid for you today, but that is certainly something I could work on gathering if you were interested in looking at. You know, when we're in the course of an investigation, if you look at the rules that we have created today for you to vote, this really does speak to our process. And because it is such a difficult process for providers, and it is, you know, particularly when we have to go into tandem investigations with Otis over at ODHS as it relates to abuse and neglect, we want to make sure providers have everything available to them to understand their due process and understand how we're going to proceed. And that is part of the motivation for bringing these for vote today. We also want to promote consistency in that process. And so when we have rules that govern the agency on how we will proceed, that will guarantee that our staff and our system is all moving in one direction. And certainly we know that our investigations team is relatively new. We started in 2018 as a small pilot, and then went statewide after we received some additional staff thereafter from the legislature. And we are still working out and working with providers on what works and what doesn't work as it relates to building that rapport, or as it relates to getting the information and not being disruptive to their day. So I hope that's helpful for you, Angie, and I'm really happy to answer any questions you like, or come back with more information.
Okay, thanks, Alicia. And council, just remember, we've got 5 rule sets to look at. So Peter, what would you like to ask or say?
Alicia, thank you. This is like Angie, it's very helpful to hear the overview, and just to confirm that this is taking existing practice and codifying it into rule. So I appreciate that. And is there anything around investigations that might in any way violate the terms of the collective bargaining agreement? Is there any changes by putting this into rule? Are we in any way impacting the collective bargaining agreement?
I don't believe that is the case. And as it relates to the collective bargaining agreement related to childcare licensing, there is the Provider Bill of Rights, which does talk about the need for technical assistance when asked, as well as the right to receive a complete report. And so there's also information on just general like communication practices between the agency and the union. And as far as our investigations procedures go, there's nothing in the contract specific to investigations.
Thank you.
Okay, thanks. Subin.
Thank you. Can you tell me, do you have any data or information on how frequent investigations happen right now? And as a result of these rule changes, what you imagine might change? Would there be more investigations, less? Like, how would that change? And then my second question is, what is the impact to us and use DELC if we don't approve this rule set today? Would we vote on it again in January? Like, what would that look like?
Great questions. So what I can tell you is because all of the procedures and rules that we're bringing to you, they're already in our policies and procedures informally. No changes to the complaint process would be noted today in the vote on these rules. So we received, last time I checked, Subin, and I don't have the exact data on me, but last I checked, we're looking at about 80 complaints per month. And we do investigate and are obligated to investigate any and all complaints which are related to regulatory allegations. And so anytime somebody calls us alleging a rule violation, we do an assessment and we do make contact with that provider to create that finding. We have in our law that, in statute, that anybody may make a complaint anonymously. And so we are obligated to investigate those. And I know that seems like a lot statewide, and it is a lot, but these are young children, vulnerable populations. And I think it's a sign that the system is working, that we do receive so many complaints because people care about child safety and not everything is valid, right? So we go out and if something is invalid, it doesn't go on somebody's record, and not everybody in the public knows what our rules say or don't say. And so that's our job to assess when somebody gives us a call. And as far as your second question, what I can tell you is some of these rules are, as I pointed out in the slide, some of these rules are as a result of legislation that has passed, and the contested case hearings rules in particular are temporary rules that are now getting voted for permanent. So there would be a deadline towards the end of the month, which I think Chris can speak to a little bit more clearly on kind of when those rules would be set to expire and the council would need a vote. Chris?
Yeah, so I just wanted to elevate two things. Hi, everyone. My name is Chris O'Grady. I'm the Legal Affairs Manager here at the Department of Early Learning and Care. We do have a childcare labor liaison that makes sure all of our rule drafting and rulemaking processes are in alignment with the collective bargaining agreement with the unions, and she also handles the grievance processes. So all of the rulemaking drafts have been vetted through the CBA to make sure they're in alignment with that. Also, in regards to this rule set, half of these rules were passed by the Early Learning Council as temporary rules in June of 2023. So we need to, the council needs to take action on them to make them permanent before December 27th, because if action isn't taken, then they'll be repealed. And there's some legislatively mandated aspects of the rules that we need to put forward, especially for union representation and contested case hearings for providers. And that went into effect on July 1st of 2023. So that's why we had to pass them as temporary rules. And then we did more robust community engagement through our rulemaking advisory committees. So those we do need to move forward. And as Alicia mentioned, these do function as informal rules as agency processes and procedures right now. So even if the investigations and findings rules aren't passed as permanent rules, if a provider or the agency had any of these rules challenged before an ALJ or in the court, an administrative law judge or a court would rule that these practices actually have the formal impact of rules, and they would look at it as if they are rules promulgated by the agency, because that's how they're being used in policy and procedure. And so just wanted to amplify that enacting these rules and voting on these rules actually adds a layer of transparency for the public and also as agency staff for both way accountability on how we're functioning, and we're putting statutory requirements for findings, investigations, and hearings into our rule set, so it's more transparent for the public.
Okay, thank you, Chris. Katie.
I'm trying to absorb as much as I can to fairly assess the situation. I have two general questions. One is, do other states with early learning divisions, do they also do the enforcement within them? I'm seeing Alyssa's head shake. And number two is, were there any substantive changes in enforcement from the time before and after July, when we formed the Division of Early Learning and Care? How was it handled? Was it handled any differently when we were not structured as we are now?
So as of since July, since Department of Early Learning and Care has been formed, there's been no changes other than name changes in our statute, and then the changes you would see in House Bill 3558, which are noted within this rule set. The biggest change you will find in House Bill 3558, in my opinion, is the change of definition of childcare, which now relies on operating hours. This is actually a benefit to business owners because it provides much more clarity into when the rules apply and when they do not apply. That is especially important when we're talking about individuals' personal residences where they also have their business. So that gives us and providers both a clear roadmap on when these rules apply, when do you have childcare children present, and then you can have a personal life after the fact with children in your life. And the state isn't going to apply the rules. And believe it or not, we actually did not have this clear in law until this July. So it's a really good benefit for us. But I will say, as far as enforcement goes, other than the interference of investigations, which is now prohibited, that there has been no changes to our determinations, the way we make decisions, and how we enforce the rules.
Okay, good questions, Council. Other questions? Other comments? Okay, so I would entertain a motion to approve the general rules for all facilities and labor union representation contested hearings that would make permanent these changes in these rules as indicated in our agendas. So, and just FYI, because of the Secretary of State's office requirements, in making this motion, we need to list all of these numbers, just so you know, because on one of these, if we go that direction, there are, I think, 50 or 60 references. So it's not to be taken lightly. Before we put a motion on the floor, any other comments or questions? All right. I've asked Peg if she would be willing to read the motion, which is in our agenda.
So the proposed rule language amendments dated December 6, 2023 that adopt Oregon Administrative Rules 414-075-000, 414-075-0010, 414-075-0130, 414-075-0230, 414-075-0250, 414-075-0300.
Thank you, Peg. Is there a second for that motion?
Second.
Thanks, Peter. Peter seconded the motion. Any further discussion of these rules, this rule set?
I just had one quick clarification. Alicia had mentioned in her comments that the DELC would be doing a risk assessment on each rule, and I just wondered what kind of input is that, internal, or is there opportunity for other voices to sit down and with you during that risk assessment?
absolutely opportunity to engage on this. Right now, we are in a pilot phase where we are conducting kind of an internal study based on licensing specialists' assessment of where they feel the risk is based on what they are seeing in actual reality in the field. And from there, we will create a more finalized set. I will say that we have already engaged with Child Care Union on that and received their feedback, as well as conducted some preliminary engagement at various committees to inform people of this work. But we are committed to conduct this transparently with engagement as the process moves through. And so right now we're in kind of an early pilot stage where we're just conducting some studies internally, but would love your feedback, Marie, on who you may think would be a good individual to engage on, or whether it's the council themselves. Happy to bring back more information on that if you like.
Okay, thanks, Alicia. All right, let's go ahead and vote on this motion. And Gabby, I'd like you to read the roll and just go through it relatively quickly. Thanks.
Perfect. Okay. So Angie Blackwell.
Yes.
Katie Brooks.
Yes.
Peter Buckley.
Yes.
Elizabeth Farrar Campbell.
Yes.
Barry Ford.
Yes.
Robin Hill Dunbar.
Yes.
Dr. Peg Miller.
Yes.
Subin O.
Yes.
Ruby Ramirez.
Yes.
Marie Simons.
Yes.
And Sue Miller, Chair.
Yes. Thank you. All right, thanks, Council. Let's move on then to the second one that is in our packets, which is about the certified school age center rules. There wasn't any public input on this one, I think, so this may be relatively quick.
I think this one will be quick, Sue. We engaged in, oh, sorry, can we bring up the slide again, Gabby?
Got you. Yep.
Thank you so much.
It would start loading.
While it's loading, I'll just kind of note, so the intent of these rules is to align with the major revision of certified centers that was passed earlier this year by the Council, June 2023, as we moved through implementation of the school age rules set, which was passed the prior year, June 2022 by the Council. We have noted that there's just some additional cleanup to ensure that the rule sets are aligned, as well as we found abilities, questions come up and we look at that and we realize it's not as clear as it could be. And then also we've incorporated some feedback regarding inclusive practices. We held a RAC and no equity or fiscal impacts were identified, and we received a lot of positive feedback regarding changes to align the qualifications, removal of redundant rules, and then the use of inclusive language and clarifying the unclear text.
All right, thanks, Alicia. Any questions or comments about this rule set? If not, I'd love to have a motion. Peter's moving approval. Peg, will you, and just bear with Peg, she may need some help. Sorry, she's got to read all of these numbers.
I'm happy to help if that's the help.
Okay. Do you want Peter to take one, Peg, and you take others?
Do you want to take over? Well, never mind. I'll just do them.
Okay.
I move to adopt the proposed rule language amendments dated December 6, 2023 that adopts Oregon Administrative Rules 414-305-0100, 414-310-0110, 414-310-0120, 414-310-0130, 414-310-0140, 414-310-0150, 414-310-0160, 414-310-0170, 414-310-0180, 414-310-0190, 414-310-200, 414-310-0210, 414-310-0220, 414-310-0230, 414-310-0240, 414-310-0250, 414-310-0260, 414-310-0270, 414-310-0280, 414-310-0290, 414-310-30, -0300, 414-310-0310,
Peg, let me ask Peter to give you a breathing spell and a water break.
Thank you.
Peter. Whoops, you're muted, Peter.
Muted.
414-310-0330, 414-310-0340, 414-310-0350, 414-310-0360, 414-310-0370, 414-310-0380, 414-310-0400, 414-310-0410, 414-310-0430, 414-310-0440, 414-310-0450, 414-310-0460, 414-310-0470, 414-310-0480, 414-310-0500, 414-310-0510, 414-310-0520, 414-310-0530, 414-310-0540, 414-310-0550, 414-310-0560, 414-310-0570, 414-310-0580, 414-310-0600, 414-310-0610, 414-310-0620, 414-310-0630, 414-310-0640, 314-310-0650, 414-310-0660, 414-310-0670, 414-310-0680, 414-310-0690, 414-310-0700, 414-310-0710, 414-310-0720.
Wow, Peter and Peg, thank you very much. Is there a second for this motion?
If you second, you have to repeat all the numbers. So
I'll second.
Wait. Thank you, Katie. Oh my gosh. All right. All those in favor, Gabby, please do a really quick roll call.
Yep. Angie Blackwell,
Yes.
Katie Brooks,
Yes.
Peter Buckley,
yes.
Elizabeth Barr Campbell,
Yes.
Barry Ford,
Yes.
Robin Hill Dunbar,
Yes.
Dr. Peg Miller,
Yes.
Subin O,
Yes.
Ruby Ramirez,
Yes.
Marie Simons,
Yeah.
and Sue Miller.
Yes, thank you. All right, next up are the rules for registered family childcare home. Alicia, we back to
Okay,
you.
Gabby, if you could share the slide, I'll just keep going. The rules up for vote are impacting registered and certified family childcare providers as a result of mandated changes due to House Bill 2468, which passed this last legislative session. This amends rule language to both rule sets, and there will have to be 2 separate votes on these for both certified family and registered family. That will, and what the rule language does is it does not include providers' own children ages 10 through 12 in staff capacity or staff child ratios unless that child has a disability that requires a higher level of care. We did hold a RAC in October related to this. No additional equity or fiscal impacts were identified. But I will say, if you can move to the next slide, we did provide one additional change as a result of written testimony. And Gabby, that language is reflected on the next slide. So we did make some adjustments as a result of written feedback that we received, just to clarify in this language that when children are attending regularly, we expect them to be childcare children, but occasional visits by children or family members are not what we're looking to prohibit. So we did clarify that language.
Okay, thanks, Alicia. All right, council, questions about these registered family childcare home rules or comments?
I have a question, Alicia. What does occasional mean, or is there, what's the boundary there?
So the original language had that, and so we have revised that language to make it a bit clearer. So what we're not looking for is occasional. So we're really looking for children who are attending on a regular basis during operating hours. They must count into capacity or ratio. And so you know, if what we're saying is we have a visitor log, for example, requirement. So if somebody's coming over and is considered a visitor and not regularly attending, this is allowed. There are rules and requirements requiring for somebody to log in. So we have record of who was in the facility during that time. But really our intent is to think about when children are attending regularly, and you know, that would require that a child be enrolled in the facility.
Okay, thanks, Ruby, for the question. Any other questions, comments? If not, I would entertain a motion to adopt these rules.
So moved.
Thank you. Was that Katie? Thanks,
That's
Katie.
me, Katie. Do I?
Is there a second for that?
I'll second it.
Okay, thanks, Peg. Katie, do you want to read the numbers?
Sure.
Go ahead, go for it.
I move to adopt the proposed language amendments dated December 6, 2023 that adopt Oregon Administrative Rules 414-205-0000, 414-205-0010, 414-205-0020, 414-205-0035, 414-205-0040, 414-205-0055, 414-205-0065, 414-205-0100, 414-205-0105, 414-205-0110, 414-205-0130, 414-205-0150, 414-205-0160, and 414-205-0170.
Well done, Katie. Okay, ready for the vote. Gabby, will you please call the roll?
Yep. Angie Blackwell,
Yes.
Katie Brooks,
Yes.
Peter Buckley,
Yes.
Elizabeth Farrar Campbell,
Yes.
Barry Ford,
Yes.
Robin Hill Dunbar,
Yes.
Dr. Peg Miller,
Yes.
Subin O,
Yes.
Ruby Ramirez,
Yes.
Marie Simons,
Yes.
and Sue Miller.
Yes, thank you.
Perfect.
All right, sort
The
of the
next one is
same,
also certified families. Yeah.
right, certified families. All right. Alicia, is there anything to add?
There is
No.
not. We conducted the RAC simultaneously with both rule sets, and we had both represented providers types at the RAC.
Okay, yep, they're consistent. Okay, I would love a motion and then we'll discuss it. Will someone move approval of these certified family childcare home rule set? I know you're hesitant to make the motion because you might have to read the numbers. Peter, thank you.
So moved.
Is there a second for that?
I'll second, Katie.
Thanks. Thank you, Katie. All right, discussion of this motion? Hearing none. Peter, will you please read the motion?
I move to adopt the proposed rule language amendments dated December 6, 2023, that adopt Oregon Administrative Rules 414-350-0000, 414-350-0010, 414-350-0020, 414-350-0030, 414-350-0040, 414-350-0050, 414-350-0080, 414-350-0090, 414-350-0100, 414-350-0110, 414-350-0115, 414-350-0120, 414-350-0130, 414-350-0140, 414-350-0150, 414-350-0165, 414-350-0170, 414-350-0080, 414-350-0210, 414-350-0235, 414-350-0250, 415-350-0375, 414-350-0390, and 414-350-0405.
And Peter, just really quickly, it was 414-350-0180. I think you had said 0080.
414-350-0180.
Thank you.
Okay, thanks. Any discussion of the motion? If not, Gabby, please call the roll.
Yep. Angie Blackwell,
Yes.
Katie Brooks,
Yes.
Peter Buckley,
Yes.
Elizabeth Farrar Campbell,
Yes.
Barry Ford,
Yes.
Robin Hill Dunbar,
Yes.
Dr. Peg Miller. Peg. Okay, I heard that. Subin O,
Yes.
Ruby Ramirez,
Yes.
Marie Simons,
Yes.
and Sue Miller, Chair.
Yes, thank you. Okay, the last rule set on ERDC late payments and rate increases.
Thank you. So I'm bringing this proposed rules forward. The purpose is to implement legislatively mandated changes due to House Bill 2468 from the 2023 legislative session, as well as implement the ERDC rate changes to align with our child care provider collective bargaining agreements. So first, I just RAC was held in October that brought forward some of the positive fiscal impacts for childcare providers with the rate increases, and some feedback regarding the need for accessibility in our late payment request process, what that operationalization will look like. We did make some changes based on public comment that came after the RAC that you all have access to. Those changes include in the rule language requiring us that there will be a specific process through the direct pay unit at DELC for claiming the additional payment related to the late fee, as well as the removal of the federal shutdown language as an example of an exceptional circumstance when DELC would not pay out the late fee. I do want to just provide a little bit of background on both of these components real quick before you consider adoption. On the rate increases, the new rate tables, I just wanted to provide the background that ERDC subsidy rates are informed by the Oregon Child Care Market price study. Federal rule requires the states to conduct a market rate study every 2 years. Our federal benchmark is to be at 75% of market rate. Oregon's last market rate study was done in 2022, and the rates that you see in the proposed rule are the ERDC rates are at 80% of our market rate, a market price study for all provider types. What this means is the 80th percentile means that our rates are intended to be high enough that a parent can access 80 out of every 100 slots in their area. So that's some background on this, specifically on the provider rates, and those align with the collective bargaining agreements that were ratified in August and September with our childcare unions. Just in terms of background for the late payment piece of this, I know that there was some public comment regarding kind of a history with this, with the ERDC program. And we wanted to just be fully transparent that we recognize that late payments are never acceptable in our opinion. And the current process is highly manual and provide opportunities along that process for the system to break down. We are working with ODHS, who we have our IAA with, because they send out the payments for ERDC. So we're working with them on process improvements, but recognize the current process is very manual, provides lots of opportunities for that breakdown. And there's only so much improvement that we can do. We are working towards the development of that provider management platform, which would be launched the end of 2024 and would bring those payments in-house and provide additional opportunities for us to improve the process to avoid any potential late payments.
Okay, thanks, Dorothy, for being on top of this incredibly complex program. Questions from council members or comments? Yeah, Katie.
So appreciate the reference to the process, as it's had bumps, we all know, in the past, and don't beat the pony while it's not alive. But it's just one of these things that I just want to emphasize from somebody who has heard from providers and over the last couple of years, when we're trying to get money out the door and it just didn't happen, and none of us want that to happen again. And so we shall say no more about that. But the reimbursement process, should this occur for late payments, just some assurances that it is a very easy process for providers to use, so that if for some circumstances it happens, they understand the process, it's expedited, they don't wait, and it's not something that's complicated for somebody who's a very busy provider to go through.
Thank you for that. So just very quickly, we're working on it being as accessible as possible, including the avenues that they already are familiar with, including contacting DPU over the phone to be able to complete the form, or having a form that's available online for them to do on their own as well.
Okay, good question, Katie. Peter.
Yeah, thank you. Alicia, from the public comments, there's a note about the former contract being referred to instead of the current contract. Has that been adjusted?
I can take this one. So the reason why the former contract was referenced as a reference material was because we didn't have the signed collective bargaining agreement that was bargained for in July, signed by both the union and the state. And we actually didn't receive this final signed collective bargaining agreement from both parties until last week as an agency. So we referred to the old bargaining agreement just as the framework in which we bargain for rates, but we can reference the new collective bargaining agreement now that is a public document and has been signed by both parties.
Great, thank you. And just a note, obviously from the public testimony, there's a lot of mistrust. And I know that it just happens when people are working together, but I think we need to do everything possible to lower the level of mistrust. I would assume, I would be concerned too to see language that pretty much says, if the agency can't pay the fee, then it won't pay the fee. That's somewhat what it sounds like to me. And I really hope the agency does pay the fee consistently, and that we're not hearing from providers that they're not getting paid a late fee when they deserve it. So I just want to express that concern on the record. that fee needs to go out if that fee is if a provider is eligible for that fee. And I'm really hoping the agency doesn't use this as a we don't really have to do it clause. So just want to put that on the record.
And Chris, can you just say a little bit about how many of those fees we've paid out?
Yeah, I will actually let Dorothy speak to that as the ERDC program manager, but I do want to emphasize that this process is really meant to make it easier for providers to get this additional payment when there is a late payment by the agency, because right now they need to utilize the grievance process with their union, and only union represented providers actually have the opportunity right now to get this additional payment. And this new change in the rule allows for all providers to get that additional payment and that 9% fee without going through that grievance process. So it will be an easier process for them.
Okay, thanks,
Dorothy,
Chris.
go ahead.
Yeah, happy to provide a little bit of context. So again, the current process is only through the union grievance. So that's the data that we have to pull from. And looking back over the last 6 months, as I look at the number of providers who have been impacted, it's ranged from 1 provider in the month of November to 13 providers back in July that was related to a transition issue. So it can range each month.
Thank you.
Angie.
Hi, thank you. Thank you, Dorothy. I did note that the rule set has changed a little bit from original in that the exceptional circumstances clause that the federal shutdown had been closed. But I still see that list is very broad. And if I understand correctly, a few minutes ago, you said that ODHS continues to handle the payment system. And one of those items on that bulleted list is anything caused the origination outside of the department that the department has no control over. So essentially meaning for a minimum of the next 12 months while ODHS is handling payments, that would be a way of justifying not paying the fee, in that the department DELC doesn't have any control over that other program. Can you speak to that a little bit, and about the very general or broad nature of those exceptions?
Yeah, so just in terms of that, while the payment is is submitted by ODHS on our behalf, it is governed by an interagency agreement between DELC and ODHS. So I think the way that we are understanding that is that process, as it's governed through our IAA, is still within our realm of control as part of our IAA. And I see Chris shaking her head, so please tell me if I've overstated that. But
and our rule set for the ERDC program states within our rules for governance of the program that any shared services that we have through interagency agreement with ODHS are actually governed by us as the department and fall under us because they are under our shared services. So it's really the way they give us our services under the IAA are just a function of us as an agency. So that would still fall within us as a department.
And therefore, DELC would pay the 9% fee is the bottom line.
Yes. Correct. Thanks, Sue.
That gives me comfort too.
Yeah. So Angie, does that answer your question?
It does answer my question, but I continue to feel like the list is very, very broad. So yeah, it does answer my question, and I appreciate that. I appreciate knowing that the ODHS piece doesn't prohibit or is not able to be used as a reason for not paying the fee. But I do still have some concerns over how broad the list is.
Okay. Yeah. Other questions about this rule set or comments?
This is Marie, Sue, and I again just want to underscore the comments that were already made around the varying fees for what really is rural providers, and really hoping that we lean in soon in priority in terms of remedying this in 2024.
Okay. Yep. Thanks, Marie. I know it's a real issue. I understand that. All right, I would entertain a motion to approve this rule set. If someone will put that on the floor, please.
So moved. This is Katie.
Thanks, Katie. Is there a second for that?
Seconded. This is Barry.
Thanks, Barry. All right, would one of you be willing to read the numbers that go with this? Oh, it's only one. Oh, you guys are lucky.
Oh, sure, Barry. Go ahead.
All right. Happy to do it. I move to adopt the proposed rule language dated December 6, 2023, that adopts Oregon Administrative Rule OAR number 414-175-0075.
All right, well done, Barry. Okay, any further discussion or questions about this motion? Seeing none, Gabby, will you please call the roll?
Yep. Angie Blackwell,
No.
Katie Brooks,
Yes.
Peter Buckley,
Yes.
Elizabeth Farrar Campbell,
Yes.
Barry Ford,
Yes.
Robin Hill Dunbar,
Yes.
Dr. Peg Miller, Subin O,
Yes.
Ruby Ramirez,
Yes.
Marie Simons,
Yes.
and Sue Miller.
Yes. Thanks, Gabby. Chris and Alicia and I don't know, is Dorothy. And Dorothy, thank you very, very much for taking us through the rules, for being responsive to the public input that we had. And we will look forward to seeing you all again probably in January, or at least some of you. So thank you. Council, thank you all very, very much. I apologize that we went over by so much. I don't think we've done that before in my recollection. But what a productive meeting, exciting things happening around the state. There's lots of follow-up, so kind of be tuned for an email from me at some point in the near future. Lots of opportunities for you all to help us plan agendas in the future. I want to just remind you that we intend to have the February 28th meeting be in person in Salem. And I'm hoping all of you will be able to get there. Gabby will do the logistics for us. And hopefully we can plan just an informal, fun dinner, probably the night before that, since several of you will be traveling from out of town and probably spending the night in Salem. So thank you all. Any final comments before we all go our own way?
Just a note, what Angie just did on the last vote, we used to call courtesy no in the legislature. It's just a little red flags people pay attention to there. So thank you for the courtesy no, Angie.
Yep, very appropriate. That's how this system works. Okay, thank you all. Exciting kickoff. And thank you, staff, for making this work too. Have a great afternoon.
Thank you, Sue. Good to
Yep.
see you.